Good boy, Pepsi.
In outer Sydney, brave rescue dog Pepsi has had a tough start to life.
His front right paw got crushed and it was never taken to a vet to be examined or healed. Therefore, he just limps on 3 legs.
Today, foster carer Will is bringing Pepsi in to see Rob, hoping something can be done to help the gentle, lovable Samoyed.
I'm a little bit worried, but at the same time, I think whatever needs to be done has to be done.
Hello, how are you? How are you?
Hey.
Rob.
Nice to meet you, Rob.
Hello, gorgeous. You are very beautiful, please. You know, this is the only breed standard that actually says friendly to all mankind. He even loves me, how good's that? And they really are, they're a beautiful breed. Oh gosh. We've got a leg problem, gorgeous. Come on in, we'll have a look at it.
Let's go.
So, how old is he?
Pepsi is 2.5 years old.
Oh, gosh, I know that's a bad... Oh.
See, it's okay, it's okay.
It's all right, it's all right. I'm having a feel of Pepsi's bad leg. Yes, the atrophy is obvious, and there's something going on really bad in the wrist and foot area, and Pepsi doesn't like me touching it too much. So, when did this occur?
Well, I believe he was involved in a car accident at a really young age.
Right.
I believe the wound injuries were self-healed. The owners never took him to a vet.
Not really self-healed, are they? I mean, he's got contracture of all the ligaments and tendons, and he's got atrophy, a very small leg compared to this side because he's not been able to use it for so long. He's got a bad callus at the front. If it stayed as a callus, at least that would be okay, but the bones are going to come through that callus. You can't keep walking on the front of the foot all the time and putting it down. I know he doesn't put it down often, but when he does, he's putting it down that way instead of that way. We'll get some x-rays today, and we'll see if we'll take him right through to the very end today or not. We'll just make a decision once we see the x-rays. Very good. You're gorgeous. You love me? Yes, I love you too. You do. You're gorgeous. It's been severe trauma to this foot, and no one's looked after it, and it's been long-standing now, so we've got to try and help this poor little dog get this foot into some form of function. I'm going to do a stress x-ray where I can push the foot right down and separate all the bones so we can see the individual bones and joints. I need to get a clearer view, work out which ones have been broken and have calloused up the wrong way. Ready? Oh my gosh, what are we looking at here? Oh my God.
G'day Heather, how you going? How's little Tabitha doing?
Yeah, not too bad, thanks.
Hi Tabitha, how you doing in there?
There you go, you got your first hiss.
Do you want to come on through?
Yeah, thank you.
Come on through.
At Southpaws Referral Hospital in Melbourne, Surgeon Ben's day is off to a shaky start.
Should we say hello?
Yep. She's very feisty and she doesn't give in that easy. She's just letting you know she's in charge.
She's telling the vet who's boss.
Yep. Tabitha doesn't like going to the vet anymore. Her claws come out, she growls and hisses. You can't touch her. She turns into Wolverine.
Hey Tabitha. Not too happy to see me today.
Heather has brought in her feisty 11-year-old for major surgery. That's if Ben can get anywhere near her.
She's a rescue kitty cat. Her and her brother were thrown out of a moving car in an old plastic bag. Unfortunately, Tabitha's brother didn't survive, but she did. She's quite a little fighter.
She's already been hissing me a couple of times in there, so I know she's got a good fight in her.
Everyone's going to have to know their place.
I don't mind being told who's the boss. It's good to know your boundaries when you start out any consultation and know this is where I can go and this is where I can't go, and Tabitha was not afraid to show me that.
You have to behave yourself and do things what she says.
I've got 2 young boys at home and they were always in charge, so I'm used to being told what to do.
Today, cranky Tabitha needs all the help she can get from Ben. Her health is in serious danger.
I'll get that nasty lump looked at. When my vet checked her over, she said to me, Heather, have you seen this lump? And it was almost like a tennis ball. Lumps do not come up that much in a month unless there's something bad.
Okay, so how's that lump doing that she's got?
It's still there.
Okay.
When I looked at it yesterday, I thought it may have grown more.
Okay. So we do have the results from the sample we took.
Yep.
And it has come back as something cancerous. So what we need to do today is we're going to get her into theatre,
Yep.
remove this lump, and take very good care of her. If we can remove this lump, we potentially can extend her life, and there is a small but importantly a chance that we can cure this with surgery. And this mass involves from about the last rib up until about the 7th and 8th rib, and when we rotate this image we can see how far it goes towards the sternum as well, this area here. This is a large lump, very, very large lump for Tabitha, and I'm certainly not taking the surgery lightly. Cancer's a really emotional thing because it can cause a whole lot of pain and suffering. I know you're worried about things. How are you feeling about the plan for today?
I'm really scared and worried about her.
Yeah.
Yeah.
I don't mind if Tabitha is upset and angry at me, as long as we can get her happy and healthy and then back home with Heather. That's the aim.
I know you do everything that you can for her.
We'll put all that power behind making sure we get a good outcome for her. You're right to be worried, and I know she means a lot to you, eh?
Yeah, she means the world to me. She's my little girl. I'm scared I'm going to lose her.
Oh my gosh, what are we looking at here?
In outer Sydney, Rob is shocked at the severity of rescue Samoyed Pepsi's deformed leg.
Oh my God.
Foster carer Will is anxious to find out if Pepsi's leg can be saved.
So the initial x-rays, with the foot just cramped in position on the plate, all those toes are bent right round. Some look dislocated as well. If you look on this next shot, you can see the contracture, and there's just bones from the toes all over the place. And that bone is ready to come through. It's nearly through there, nearly through the skin now. But when we lay the foot flat and put pressure on it and do a stress x-ray, everything goes in the line. So this is awesome. This is really, really good news. What we can do, Will, I can put this into a splint today. We can't make more skin, but Mother Nature will do it for us if we keep stretching it. And hopefully that'll be the end result, that he can put all his weight on the pads and on the foot. Then we might assess there may be some surgery in the future. I cannot promise you for sure. Will, if you're happy with that plan, that's how we'll proceed.
Oh, sounds great.
Our first job is get him to walk on these pads, but with a fair bit of work and an ounce of luck, we might get there. Just trying to get a splint that comes round there is going to be the hard thing. So putting so much pressure on this, the big fear is that you could break it, but I've got to stretch it beyond that elastic limit on that area. So we're just trying to protect the open sores and try and keep them as happy as possible, simply because the whole thing's going to be under pressure.
Between the toes as well?
Yep, if you can. What Anna's doing now is packing it with cotton wool to try and protect it and hold it into as much of a foot shape as we can, as a normal canine foot shape. Okay, let's wrap it.
Rob's hoping splinting will stretch the tendons and ligaments and help coax the wrist joint into a more normal position.
There you go. All done, baby boy. The risky part is that he could get pressure sores because you don't usually put a cast on with the tissues under pressure. And they're pushing against that. So I'll be amazed if he doesn't have some pressure sores. Okay. Hey, Will, Here he is.
Oh, Pepsi.
Put him that way for you. It might be easier for him. That's it. So he's in a sling with his little cast put in there and it bent the foot up. I put the sling in such a way that it's on his shoulders, not on his neck, and he'll be able to support him quite well and hold that leg up.
Pepsi will have to tolerate the sling for at least a month. If Rob's ambitious solution fails, he may have no option but to amputate the leg.
Okay. I'll let you go. He's a bit, gets a heavy after a while.
Thank you for everything.
Pleasure. Good to see you. I'll get the door for you. All the best.
Thank you.
See you later on, Will.
See ya.
Bye-bye.
Come on. Come on, Zaki.
At Sash Emergency in Western Sydney,
You're a good boy. Eh?
worried owner Sally has rushed in with her adored Pomeranian Chihuahua cross, Zach.
Where are you? Found some grapes that I had in the fridge. I thought I'd have them. And I started to eat them and Zach's looking at me and I thought, okay, these should be healthy, you know. And I gave it to him and I was really surprised that he ate it and I was happy about it. I thought, oh, great. He's still looking at me and I gave him a few more, about 3 or 4. Then I looked on the Google to see, you know, if it's okay. And then highly toxic, they can die from them. You're a good little boy. I thought, oh my gosh, you know, I hugged him, said how sorry I was, little Zachy, I'm really, really sorry I did this to you. I'm thinking this is it, you know. I'm killing my own beautiful little dog that I love so much.
All right, Mr. Zach, why did you eat grapes?
Emergency specialist Mara is on duty and straight away begins a head-to-tail check of the little 4-year-old.
That was a very silly thing to do. I hope they were sweet and crunchy and tasty. Otherwise, no real reason to eat them, right? Grapes are something that we've learned can be toxic in dogs. Now, it's a little hard, my friend, to listen to you with my stethoscope when we're cuddling like this. Can we not be bestest friends? Can we just be good friends for a moment? Thank you. Some dogs can actually develop a toxicity that negatively affects the kidneys, and other dogs could eat a grape every day for the rest of their life and never have a problem. Okay, let's see how your heart sounds. And there's no way to know which dog is going to be the lucky dog and which dog won't be so lucky. But your heart sounds pretty good. Beautiful painting. All right, my friend, you look pretty stable. I think we just need to get the grapes out of you. It's not going to be your favorite part of the day, I'm sorry.
Mara's hoping an injection of apomorphine will cause Zach to vomit the toxic grapes.
Okay. See, that didn't take you very long.
Now it's a waiting game.
All right, my friend. Now we give you time. What do you think? A watched dog never vomits. Just get to stand here and wait.
Not too happy to see me today.
At Southpaws Hospital in Melbourne, Ben's still not having any luck winning over feisty Tabitha. So he now wants to get her straight to surgery to check out her rapidly growing lump.
You'll be brave now, hey?
I love you, puppy.
It's time for an emotional Heather to say goodbye.
You be good. Don't bite them nor scratch them.
You know she's not going to be good. You can't promise that. Come on, friend, you're coming with me.
I do feel confident that she's in the right place. It's just I'm scared. And I don't want to lose her. Because Tabitha's my little girl. Just don't want to lose her.
Thank you. You are so brave. Okay, perfect. Beautiful.
Tabitha's now fully anaesthetised.
It's a big mass. It's really stuck in there.
That lump has grown, hasn't it?
Everyone is shocked at the size of the lump.
It measures about the size of a large orange, which is a fairly large size. I think we're really seeing the tip of the iceberg.
Before removing the lump, the first step is an ultrasound, so Ben's colleague can work his magic.
Sebastian, our anaesthetist, has got a special interest in pain management. What he's doing is what we call a quadratus lumborum nerve block. It's like a spell that maybe Harry Potter does, injecting a little bit of local anaesthetic to the nerves that supply your sensation to your body wall. It's kind of like an epidural if you're having a cesarean section.
Coming in hot.
With Ben and his team now ready, nerves have set in for Heather. She's already lost one beloved cat to cancer.
Tabitha had a big sister who she absolutely adored. Missy, unfortunately, she got a very aggressive cancer of the stomach. The cancer had gone to her brain, and I had to have her put to sleep. And that's just 3.5 years ago. And when Tabitha had this lump, and saw that, and I thought, oh, I can't do this again. I just can't lose my little girl again.
Can we get the table up just a touch as well? That's good, thank you very much. This is all the tumour in here, this structure, big structure sort of around here. So that's all the big mass. It's time to go to work. And once we start, everyone knows where they're supposed to be. First incision, it's almost like they're conducting an orchestra. Main concerns, I suppose, are related to her pre-existing anemia. Anemia is a term we use to describe when the percentage of red cells in our total blood volume is reduced. Red blood cells are really, really important for carrying oxygen around the body. Did we get a repeat blood count on her?
I'll just have to get the results up for you. One moment. 22.
Because that's come down a bit.
Yeah.
Given the fact that this cat is already anemic, we want to try and limit as much as possible any bleeding.
To remove the lump, Ben needs to cut through several of Tabitha's ribs, using some practical know-how.
If you're into gardening, cutting through a cat's rib is very much like pruning roses.
Ben has to be extra vigilant to avoid the large blood vessels that run down the back of every rib.
There's a few little blood vessels in here, and I just want to be careful.
Okay, scissors. My heart's in my throat because the big worry is just, have we done more harm than good? It's always the worry.
In outer Sydney, rescue dog Pepsi has been in a corrective cast for 4 weeks, and it's time for Rob to see if there's any improvement in the angle of the young Samoyed's badly deformed leg.
In this case, there was no right way to put the cast on because the whole thing was so deformed, and we're trying to use the cast really to put pressure the other way. I don't know how that's going to go. We're about to find out. Last thing I want to see is like a dead foot with lots of pus and tissues of the dead, because that's going to then mean amputation of this limb. Now, the piece de resistance. Let's see what's under the bandage, AM. Okay, yuck. So we've got some pus there where that sore was. As soon as I lift the bandage, it's just green pus, yellow-green pus. Oh no, the foot's gone necrotic, it's gone dead, and I'm not going to be able to save this foot. We achieved something. We've got some degree of mobility of that joint again, so that's good, but it's going to be a surgical case from here. We've just got to clean up some of this pressure sores that we've got, and then I think we're going to ankylose that with either a plate or some pins. I think we're going to get there. I can see some light now at the end of this tunnel. So because this is so deformed, I want to take some intraoperative x-rays. This is very deformed foot. I need to make sure that everything's in the right position when we put the pins in. So I'll have a nurse taking these radiographs as we operate, so we can keep checking to make sure the pins are placed in the right spot. Yep, all good.
And cut now?
Cut now, perfect. This is not a curative surgery, this is a salvage surgery, so we can salvage what we can and have this leg hopefully in enough position where the dog can use it as a bit of a splint when it's walking, a bit of support for the other good leg. Come on, a bit of purchase. A little bit of purchase.
Can you vomit? Can you vomit right in there? Yeah, just go and bring it up.
At SASH in Western Sydney, emergency specialist Mara is hoping an apomorphine injection will start to work quickly and Zach will vomit his deadly snack of toxic grapes.
Please, just vomit. Just do it. We just want to get Mr. Zach's stomach empty because if the grapes are in there, the sooner we can get them out, the better he's going to be.
Owner Sally is devastated after giving what she thought was a healthy treat to her precious boy.
And who would have known that grapes is so highly toxic to them? Check before you give them anything to eat, you know, even if you think it's super healthy, but not for them.
Hi, what do you think? What do you think? I know, you just want to shake it off. Huh? So far, Zach hasn't vomited with that first dose of apomorphine, which is not what I would want to see happening, but it's not uncommon. So we will try a second dose and see if that is enough to kickstart things in the right direction.
Oh boy, mister.
Okay. Oh, so brave. Yes. Okay. Will you please vomit? Pretty please? With grapes on top? He's showing not the least sign of being nauseous, which makes me kind of want to bang my head against the wall a little bit. So it's time to get creative and see if we can do anything else that might make him nauseous. All right, we need a stool.
Time is now critical, with Mara desperate to try anything to make Zach vomit.
So, things that make me nauseous? Spinning in circles. What the hell's going on, huh, my friend? Don't worry, you're not the only one dizzy. Okay, that's enough for me. Woo! Take him.
Mara's definitely feeling nauseous, but as for Zach...
Oh, don't tell me I went through that. You're not gonna vomit, darling.
The grapes are staying put.
I'll just lip smack, that's it.
We've started the licking and the swallowing.
A bit of licking is the only progress so far.
I know, Zach, you can do it. It's okay, just let it go. Please. I am not quite defeated, but my optimism is going down. I know it's awful, and if you end up vomiting on me, it'll be worth it.
Mara's refusing to give up on her stubborn little patient.
Come on. Please don't have an iron stomach.
Come on, a bit of purchase. I don't want to take too big a piece, I don't want to damage the bone. Just got to get just enough.
In Outer Sydney, Rob is starting surgery to try to correct rescue Samoyed Pepsi's shockingly deformed leg.
So we're starting at the humerus, it's the, your upper arm, and we're harvesting some special type of bone to try and use that inside the actual joint, the wrist joint, to stop the wrist joint from being a joint, really. It's going to be solid mass, we hope, when it all heals in 6 to 8 weeks. We've got a nice little piece of bone there, and that just goes into some saline. We don't want it to dry out. Now we'll sew it up and then get to work. The real work begins. I just want to make Pepsi's life as happy as I possibly can for as long as possible. Yeah, that's what I'd like to end up with. Gosh, it's a big push to end up with that. So I need a pin through there into there.
Pepsi's foot realignment will be in 2 stages. First, the harvested piece of bone will be inserted to make the ankle rigid. Then pins will be used to keep the toes in place.
So we're just making our way into that wrist joint itself. and that's where we'll put our bone harvest that we've got. Oh, I'm just curating or scraping, if you like. The joint is just falling apart. Bones here are very, very soft. The problem is it may release the pins. Now that's my biggest worry.
Please don't have an iron stomach. Please.
At Sash in Western Sydney, Mara has met her match. Pint-sized Zach still won't vomit the toxic dose of grapes.
Give in, my friend. I promise it's okay.
Mara's hoping it will be third time lucky, so Zach can avoid potential catastrophic damage to his kidneys from the toxic fruit.
That's right, you just shake it off. I have not had many patients resist vomiting after having a third dose of apomorphine. Come on.
Nothing seems to be working, so it's time to switch to plan B.
We're gonna try the creamy tuna-scented treat and see if that makes our friend decide to vomit. Again, this attempt, anything at all that might make you vomit, I mean, if you're feeling at least a little nauseous and you smell something fishy, let's try that and see if that triggers things for him. Hi. You want some smelly foods? What if I put a little tiny bit in your mouth?
With the grapes staying put,
You're just not vomiting for us.
Mara has one last trick.
If we can't get the stomach to empty as the first part of decontamination, the second part is giving activated charcoal, which is going to bind to the toxin that is still in his stomach and hopefully prevent it from being absorbed into his system. So fingers crossed that the charcoal at least will help decrease the risk for him. Mr. Friend, we're gonna try and keep you clean. I don't know if we'll succeed.
Oh my gosh, it's dripping everywhere.
I'm sorry. Giving charcoal to a dog, it tends not to be a smooth and simple process. You can do it. Swallow, swallow.
Is that nice?
Zach is a dog that's going to need us to really help him. Oh, so brave. Oh, so brave.
So Anna's just really carefully cutting through the ribs as we go.
At Southpaw's Hospital in Melbourne, specialist surgeon Ben is at a crucial stage of Tabitha's lump removal surgery.
The blood vessels sit just behind the ribs, so we kind of go one space at a time just to make sure that we control bleeding.
To reach the lump, Ben eventually has to cut through 7 of Tabitha's ribs.
Making nice progress. And then just a last little cut just here.
Finally,
It's a big mass.
the massive lump, almost as big as Tabitha's head, is revealed.
It measures about the size of a large orange. And what we do is we send that across to our local laboratory. I'm hoping to be able to say to Heather, not something we need to worry about, and we've got it all. So I think the biggest thing with these tumour removals is once you've removed them is just to be really careful and check your bed where you've removed the tumour from to make sure we haven't left any blood vessels bleeding. Kind of go, yes, the mass looks really interesting, but we have to make sure we focus back onto our kitty cat.
With the lump out, Ben now has the tricky task of trying to stitch up the gaping space.
Can we please get some suture to close? Can we get some 2-0 PDS, please? If I don't close it, we're going to be left with a gaping wound that causes a hernia. And that can potentially result in abdominal organs popping out the side of the body wall, and that could be catastrophic for Tabitha. You can see there, then we've got a complete seal on our chest, and the next part is worrying about our body wall. And we're actually going to use some mesh to reconstruct things. The mesh is kind of like the same sort of material you have on your fly screen door. It's a synthetic mesh. We're going to just cut our mesh to size and then suture it in place. It's closing really nicely.
With the lump removed, Ben now has the tricky task of trying to stitch up the gaping space.
Surgery's gone really nicely. She's been nice and stable through anaesthetic. I think it couldn't have gone smoother. Now it's sort of onto the post-operative recovery, and hopefully in a couple of days she'll be feeling a lot better.
Oh, she did so well.
I know.
The biggest challenge ahead for Heather will be keeping her feisty Wolverine calm and quiet as she recovers.
I can't tell her to sit quietly with her feet up. She's not going to do that. Cats have got a mind of their own with recovery, and I know full well that Tabitha is probably not going to follow my instructions.
You are so brave.
You can do it. Swallow, swallow.
Nice.
At Sash in Western Sydney, Mara and nurse Sarah are feeding activated charcoal to stubborn Pomeranian Zach, who is still refusing to vomit potentially poisonous grapes.
Swallow. Oh, good boy.
The charcoal will bind to any deadly toxins in his stomach and hopefully prevent fatal kidney damage.
Is that nice? He says no. No, that's not nice.
Good. Nice job.
Oh, so good.
Nice job. Wow.
Look at you. You're a rock star. The hope is that he is going to be one of those lucky dogs who doesn't develop toxicity regardless of what we do. And that hopefully the charcoal that we've given him just gives us that little bit of extra safety. Can we take this off of you? Pop. Hi. I think that's about all we're gonna get.
Done.
For owner Sally, it's been a nerve-wracking wait.
You have the bravest little boy. He
been
was
a brave
so
boy.
good.
He's a brave little boy. He's little, but he's so brave.
Good.
Good boy, Zach.
We'll have him go home with you and just keep an eye on him.
Yeah.
If he starts to seem really sad and lethargic, if you're seeing that he's not eating, if there's any change in how much water he's drinking or how often or how much he's urinating,
It's abnormal. So
those would all be indications that he should get rechecked, and you're welcome to bring him back in here to us. If he does great, then he's the luckiest little boy ever.
So I'm feeling really, really relieved at the moment. And I can come back tomorrow if I have to. I know they're here, so I feel really good.
No more grapes.
Okay. Definitely no more grapes.
Yes.
We've learned the hard way.
No more grapes.
For Zachy.
Yes.
Yeah, thank you.
You're welcome.
Say thank you.
You say goodbye. Oh, you did it more.
Yeah.
Yeah. A brief goodbye. He's like, well, I like you, but that was more than enough. So gosh, I really hope that Zach is going to be one of the lucky ones. You know, he's got a great family, and hopefully that if any problem develops, they can catch it right away and bring him back to us. But crossing fingers, he'll go home and just wonder if it was all a bad dream.
That was good, wasn't it, Zach? Eh?
Oh, I'm just curating or scraping, if you like. The joint is just falling apart.
Near Sydney, Pepsi's fragile bones are making foot realignment surgery extremely challenging for Rob.
The bones of the joint are so soft, they're allowing it to just fuse in quite easily. Hopefully it will work by helping to solidify and calcify this area up. All those little bones of the wrist will start healing together. It's stiff, but supportive. Yep, that will do us. Right now we're going to take our first intraoperative just to see where we're going to put the first pin.
Okay. Let me go and check.
I'd love to get 3 pins in there. I don't know if I will. We'll certainly get 2. Okay, so that's good, perfect. That tells me where I want to go. Feels okay. Firstly, we'll see if this pin's in the right position. If it is, we'll cut and then reline one on the other side, coming across so they actually fall across. And we'll think about putting one right down the middle as well. Probably will because of the softness of this bone. Give it as much support as we can. Okay, we're in the radius. Got it. I'll tell you what, I'm happy with the way this feels. It's nice and stiff, which is what we're trying to do. That's with 2 pins. If we can get a 3rd pin in, I'll be even happier. Can't be unhappy with that. That's good. So I've got the third pin in. It's really stabilised that joint as much as we can do for Pepsi at this stage. So now we'll sew it up, get out of here and get down to the toes.
After nearly 4 grueling hours, the surgery on Pepsi's leg is almost complete.
So yeah, pin number 4 now, it's in the toes. That toe's starting to straighten up, but this toe's even straighter. And these two look straight. So that's as happy as I can get at this stage. That is really good. Bit of relief that I've come to the end of a very long journey, very long journey. We're done. Oh. At the moment, life for Pepsi right now is going to be staying in the clinic for even possibly longer than I thought. Certainly a few weeks till the stitches are all out and I can see how things are starting to mend. I don't want any pressure on all those pins for a little while, and I can look after him easier in hospital than he can ever be looked at anywhere else at the moment. Good boy, you stay there and rest. Hey? I'll come back and check on you later.
In Bondi, Isabella needs to interrupt playtime to round up her Australian Shepherd, Miko, for a visit to see Kate.
Got Miko when she was 8 weeks old, so like the very second that you can get her, I got her. I always wanted a working dog. They're super smart and super loving, and yeah, I just wanted all of those elements in one.
Miko has a worrying issue that Isabella wants Kate to check out.
I noticed a few times at the park that she was kind of limping on her back leg a little bit. She'd be playing and then she'd lie down. What's going on? What's going on? You know, check. Over time, it just seemed to get to a point where I felt like it was causing her discomfort.
Hello.
Hi, how are you? Who's that?
How are you?
Doing well.
That's good. Hello, darling. Look at you. You've grown so much. Remember when you were this big? I remember when you were this big.
She's definitely going to go for a belly rub.
Are you going to come through so I can have a look at you? Oh. Do you like a scratch on the tummy? Yes, I do. Come on, little monkey. Let's go.
Miko is not the first puppy Isabella has brought in to see Kate.
Izzy's previous dog, Cora, and I should say puppy really because she was so young. She was only about 12 or 13 weeks when she came in. We found that she had a very rare genetic heart condition called Wolfhausen-White syndrome, and that led to this little puppy going into congestive heart failure when it was only 12 weeks old. It was so devastating.
Her body was just not working for her, and Kate told me that she had about 3 months to live. So we got to spend a great 3 months with her, but it was really hard. It was horrible. It was the most unfortunate event that I've ever been through. It was heartbreaking.
Hey, you ready, Anne? Ready? 1, 2, 3, go! Well done. So before we start, tell me about what's been going on.
I feel like she just has a little bit of a limp in her back left leg. It comes and goes. She loves to play at the park.
Okay.
At speed, she's fine. After she plays with dogs, especially big ones, she kind of walks away with a little bit of a limp.
Okay.
And then she'll lie down.
Has she been well otherwise? Has she been eating and drinking and doing all the right things? She looks like super healthy.
She's been great. She's been really good.
Yeah.
She's a little mixed because she's 8 months old, but she's great.
When Izzy got Miko, I felt like she was a little ray of sunshine, and I was like really hoping that there was nothing wrong with Miko at any point. Trying to feel a good leg first.
Yes, good girl. It's okay.
So as you can see, it's very difficult
She has a personality.
to see what's painful and what's not painful because she will scream and yell. That doesn't hurt. So what you can see today is that Miko isn't having any of this. She's squealing and carrying on like a pork chop. And the reality is that it's very difficult to tell in a puppy of her age whether something's pain or whether she's just being a monkey. It's okay, good girl. I know, darling.
With Miko suffering from a serious case of the wiggles, Kate decides to move the consult outside.
Here we go. Come here, Chuck. Let's go.
So what I'm going to do is I'm actually going to take her for a little bit of a run, just to see if I can actually see any lameness in that back end or even in her front legs. Okay, so do you see? Guys, do you guys see that? To an untrained eye, Miko looks completely normal, but I can see she's pretty heavy in the front limbs. And that makes me automatically think, is there something wrong with her back legs?
Well done.
No one knows their dog better than the owner. And the reality is when Izzy says there's something wrong with her dog, I take that seriously. If there is something wrong with her legs, early intervention would be ideal. And I think what we might do is keep her here and take some x-rays.
Okay.
And I think that we get an answer, right?
Yep.
The best case scenario is that these x-rays come back all clear. She might have pulled something a little bit like a human.
What is the worst case scenario?
So our worst case scenario is that she has some kind of genetic abnormality, something like a hip dysplasia, or she's got some early signs of degenerative joint disease.
Great.
Hip dysplasia is a congenital abnormality which results in an ill-fitting ball and socket in the hip joint.
I guess my worry around the x-rays would be whether there was a potential surgery that was needed to be done, or if there's something that's ongoing that's going to cause Miko trauma.
We're going to do it right. There is no cure for hip dysplasia. At very best, you can give them new hips, but what it really means is a lifelong condition that causes them pain. It means they can't do regular dog fun things. It's not a great life. That's right.
Like my instant reaction is worst case scenario because of what happened with Cora. So it's like I'm almost conditioned to feeling like that.
This is not what I expected to see at all. I'm going to send these to a specialist just to be doubly sure.
Oh my God, I cannot handle to lose her.
Come on, sweet. Let's go.
Next day, a nervous Isabella is back to hear the results of the specialist's X-ray report.
Hello, Miko. Hi. Hello. Oh no. Hi, Mama.
You want to come and have a look at these x-rays?
Yeah.
Let's do it.
Okay.
Let's just start with the good news.
Okay.
They're fine.
They're all fine.
Right? They're all fine.
Everything is fine.
Everything is fine.
Oh, everything's fine. It's like my whole body just went, I'm so relieved. Thank God.
Ankle. So that's not to say that there's not some kind of a soft tissue injury there, or there's some kind of a muscle or a tendon or a ligament that's damaged, but it does mean that she doesn't have degenerative joint disease in any of her elbows, her back, and also means that she doesn't have any hip dysplasia. When I look at these x-rays, I'm so relieved. I'm trying to look for a fault and I can't see one, and I'm cheering. So as you can see, the ball of this hip is really nice and snug in the pelvis, really nice and snug in that hip joint. That's exactly what we're looking for. You actually have a dog with nothing wrong with her.
Nothing wrong with her. Who knew that was possible?
This has been a really emotional roller coaster for Izzy. I feel like as though I have been here through that whole journey, and to deliver her some good news for once is unbelievable. What I do want you to do from here though, so a few rules. As you can see from these x-rays, she still has a lot of growth plates there. This is the edge of the tibia, and this is actually a growth plate in here. Eventually that little tibial tuberosity is actually going to form a beautiful joint. And all it would take is a very small amount of pressure on one of these to displace those growth plates.
Wow, yeah, okay.
And then that whole piece of bone basically can fall off.
So we're not out of the woods yet.
You need to be very careful that you don't injure those bones. Okay. And the best way is controlled exercise, so not letting her go for an hour at the park absolutely nuts. Yeah. Doing high impact activity would be sort of equivalent to a child doing weights, right? Their bones are soft, their growth plates are soft. We need to make sure that we look after them. Bye, you guys.
Bye. Thank you. Good girl.
Good boy. Well done.
It's been a month since Rob operated to try to correct Pepsi's badly deformed leg.
He's using that well. So Will has brought Pepsi in today. We've taken the splint off and the bandage is now right off. That's it. Pepsi.
Good boy. Look at him go.
Hello, darling. Good boy, yeah, good boy. The foot's slightly turned in still, but I'm pretty happy because it was right around. The foot was nearly facing his nose before, whereas now he's using it, and hopefully he'll use more of the pad. What I'll do is put a protective sock on it, so that will help him, and see how he goes over the next couple of months.
Good boy.
Good boy, Pepsi.
And there's great news. Foster carer Will has fallen in love with the beautiful, gentle Samoyed and decided to adopt him.
We're talking about the possible second surgery, looking like we're not going to need that. Some physiotherapy, sure. I'll just keep watching him and make sure he just progresses, because he is such a beautiful soul, that dog.
Ready?
And Isabella and Miko are now back enjoying playtime at the park,
I know, it's so exciting, isn't it?
but with a few new ground rules.
Hi. We're doing 1 leash walk a day and then 1 trip to the park. But the park is nice and contained, not for too long. Just like Kate said, very minimal impact. She loves to swim, so we're always going to the beach. But yeah, just with a little bit of caution throughout the way. Too much energy. The happier that she is every day, the more joy she brings to our family, and we're just so grateful. Nico, what's going on? All good?
Good boy, Andrew.
At Sash in Sydney, it's going to be an emotional day for Lauren, who's bringing in her adored Great Dane Archie for cancer treatment.
Good boy, Archie. Archie came into my life as an angel. Good boy. He means the world to me. What are you doing? My partner and I adopted him, and we were both absolutely smitten. And then my partner passed away unexpectedly. And Arch was home that night on the bed. And Arch has literally been on my bed every night since. I don't know what I would have done if I hadn't had him.
Still shattered from her recent loss, Lauren has been dealt another cruel blow. Archie is battling cancer.
Hello, Archie. Hello, how are you? Nice to see you. Nice to see you. All right. Hello. You're leaning on me again.
Dr. Veronica has been treating Archie for the advanced cancer in his front right leg for several months.
How has he been?
He certainly still will offload weight and lie down when
And that's natural.
he can.
Yeah, it will be natural. Archie is a 6-year-old Great Dane, and he was diagnosed with bone cancer. He had a CT scan, tried to find out where the disease is, and at this moment he doesn't have disease elsewhere. But if you put 1/4 of your body weight on the leg, which has bone cancer there, it's quite painful.
There were moments of like, he was weight bearing far more comfortably.
Even today,
Like
I can see he is putting so much more weight on it. That's amazing. So at this moment, we are in the process of radiation treatment, chemotherapy, which is the monthly infusions. So this medication gives him pain relief as well as makes the bone a little bit stronger. And the pain management is working for him. So he is using the leg at this moment. The problem is we can't predict how long for.
All right, Archie, should I take your giraffe with me?
Yeah.
I'll take your
the
buddy.
giraffe head.
Yes, I know.
This is too funny.
Oh my goodness. All right, you come in with me.
Come on, you're such a good boy.
With the cancer now extremely advanced, Veronica has advised Lauren to consider having Archie's leg amputated.
Thank you. Come on, Archie, come on. Oh, good boy, yes. Mommy is staying here for a little bit.
Today, he'll undergo tests to see if he will still be able to walk on just 3 legs.
Hello, my boy.
I just want to be making the decision that gives him the best quality of life. I don't want to put him through major intervention and adjustment if the cancer's just going to pop up somewhere else tomorrow. And it's brought a whole new perspective to my love for Archie.
I'll say Charlie, the rabbit, the bunny, yep.
At Sash in Western Sydney, emergency vet Alex is on her way to meet worried owner Keith, who's concerned about his pet rabbit, Charlie.
Hi, I'm Alex. I'm one of the vets on today. Would you like to bring Charlie through to the consult room?
Yep.
Follow me. Rabbits are quite fragile patients. They're a prey species, so they're constantly looking out for predators. They are scared of dogs and cats and other animals that we have in the vet hospital, so we do have to be aware of their needs. So what's been happening with Charlie?
This morning when I went to feed him, he was just over the far cheek. Usually he's very excited when he knows he's going to be fed. So he's off his food and just looks very, very sad actually.
And is there anything that he could get into that he'll eat? You know, like any things that don't digest? Fabrics or?
No.
He doesn't eat things he shouldn't.
He'll eat everything.
He eats everything.
Charlie's 6 years old. My wife got him as a present when our dogs died, so he's become part of the family. We've got 4 rabbits. They've all got different personalities. He's the oldest. He was the dad, the granddad, I suppose now, and he's just playful, you know.
So we'll just have a look at Charlie now and just see if he's got anything that could be causing him to go off his food today. So I'll have a little look at his mouth. There we go, it's all right. And we'll just have a listen now to his heart and also to his gut sounds. Okay, so unfortunately I can't hear any gut sounds, and normally the rabbits, their intestines should be moving all the time, and so if we don't hear anything happening in there, they can have a condition called gut stasis, which essentially means their intestines have stopped moving and then gas buildup happens. So Charlie's in a pretty bad way tonight. He's quite dehydrated, and I'm very concerned about his condition, and unfortunately this is a condition that can progress to being fatal. Sometimes when they have this gut stasis condition, their blood sugar level can get quite high. That can indicate is a blockage. Rabbits can't vomit, and so what happens is their intestines just fill up, and it can get to the point where they rupture.
Oh, mate.
He had 2 doses of radiation and infusion 2 weeks ago.
At Sash in Sydney, Veronica is introducing Archie to sports medicine vet and physiotherapist Naomi, who will assess the Great Dane's suitability for a leg amputation.
Hey matey. It's very nice. It's lovely.
I would really like to make sure Archie is able to use his other leg in the front after amputation. So Dr. Naomi is really great in assessing, does he have any issues with his shoulder or elbow? We just want to make sure that we do everything to assess how well he can do after the amputation.
Hey, and I'll swap sides with you, please. So good. My good boy.
If Naomi decides Archie couldn't enjoy a good quality of life without his front right leg, he'll go into palliative care for the remaining months of his life.
Can you have this leg? Oh, good job. Good job. His elbow feels pretty good. Wrist feels fine, and he's nicely muscled on the left-hand side. Obviously, he has wastage on the right because he hasn't been using it.
Yeah.
And surprisingly, he's very happy to wait there on this right-hand side today, which is great. Hey, my boy. All right, good boy.
After giving her verdict to Veronica,
You'll probably have a sense of how he would do on 3 legs from how he was at his worst, right?
Naomi sits down with Archie's devoted owner Lauren to share her thoughts on what's best for his future.
I think the good things for Archie is that his left front leg, he's got good muscling, he's quite comfortable in all of his joints. I can't see any obvious abnormalities on that side, and he's really happy to shift his weight over there. But if we take away a leg, he might struggle just to get up and about in general, and he probably will be less active. We can mitigate that by setting you up with a harness or assistive devices to help him walk, but very likely as the cancer continues to grow, it will get worse. Yeah.
And we anticipate reaching a point in these cases
They often end up on 3 legs anyway, because he's going to be so sore that he's not going to take weight on that leg, and you're going to end up managing them the same way.
Seeing him in chronic pain and then having beautiful Veronica say, with amputation, he could be pain-free. So I was like, this is not fair, he's suffering. But then there's the human associations to amputation, to not being whole, to not being complete, to maiming. And it's such a dilemma in terms of how he did respond to your assessment.
Yeah.
Do you think he'd have like a reasonable chance of adapting?
I think he'd
like
cope with help. It's really about choosing the consequences that you feel best able to cope with, right? And for him.
Yeah. I literally don't know what to decide. He's my angel.
Just at the moment, because his intestines and stomach aren't moving, we do have to start with injectable medications.
In Sydney's West, Alex must act quickly to try to save 6-year-old Charlie, who has a potentially fatal stomach condition that stopped him from eating.
He is a bit dehydrated as well, and that's going to contribute to him feeling lousy and not wanting to eat and drink.
Owner Keith is extremely concerned for Charlie. He previously lost a rabbit to the same gastrointestinal condition.
So I had with one other rabbit, and there was probably a little bit delay in getting treatment, and I tried to treat him at home after seeing the different vet, and he just passed away overnight.
Sometimes they just need a little bit of time in hospital, and we can treat them with the medications, and it's just 12 hours or even 24 hours. And if he starts eating for us and he starts pooing more regularly and his gut sounds improve, then we're happy for him to go home.
But I'm sure he's going to be in good hands, and we'll just see how he goes through the night. He gets his guts working again.
Hi, Kristen. So this is Charlie.
Hi, Charlie.
Isn't he cute?
Hello, aren't you lovely?
Yeah, so Charlie's unfortunately got a bit of gut stasis. So we're just going to look at his teeth. Hopefully Charlie will be a good boy. So we're just having a look to see if there's any ulcers or any areas that might be rubbing or causing him some discomfort when he's eating that could have caused him to stop eating and then develop gut stasis. There we go. Oh, that's a really good image. So I can see that he has some sharp points on his teeth here, and they might be causing him a little bit of dental pain. Once he's recovered from his gut stasis episode, once he's feeling a bit better, he's on painkillers, then we can look at having those teeth sanded down so that they're nice and comfortable for him when he's eating.
But right now, Charlie's most urgent need is fluids to reverse his dangerous dehydration.
We need to rehydrate him, and one of the best ways to rehydrate is to give intravenous fluids, especially in a bunny this sick. We need to get that fluid in quite quickly. Dehydration is making him not wanting to eat and drink, and he's just going to continue on that path, and eventually it can be fatal. God, he's so flat, isn't he?
In rabbits, the ear is one of the few viable places an intravenous cannula can be inserted.
We'll milk some of that blood into the vein.
But Charlie's extreme dehydration isn't going to make Alex's job easy.
Can't even see the vein anymore. It's gone.
Good boy. Good boy.
In Sydney, Lauren is taking her soulmate Archie for a walk before deciding if she'll proceed with surgery to amputate his cancer-ridden front leg.
Hearing the physio say he'll end up with 3 legs anyway because you won't be able to weight bear on it because of pain, and then it's like, well, then he'll have 3 legs plus pain. That really struck me.
What are you doing? What are you digging? What are you digging up?
I've said to him, what do you want, Arch? Like, let me know. I think he was like, I still got Stuff to do here. No, I'm not quite done yet. We got this, Angel.
Okay, come back.
Later at Sash, Archie is undergoing a heart scan to make sure he's fit for surgery. The lovable Great Dane has passed with flying colours.
With the amputation, it means that he can have a great few months. That's what's really good.
With her good friend and Archie babysitter Louise by her side for support,
Are we coming in here? Hello. There we are.
Lauren is ready to tell Dr. Veronica her decision regarding the amputation.
He's been a very good boy today.
He's been with me through some very dark moments. And I've said to him, this is about you, Arch. It's not about me. So he has to have the amputation. I just want him to be happy.
All right. I know it's a hard process to go through.
Thank you.
Thank you.
Thank you.
Lauren's heart-rending decision means Archie will have surgery to remove his leg tomorrow morning.
Aren't you the cutest giraffe ever?
Everything's gonna be okay.
In Miami, Michelle and Gaston are trying to put on a brave face as they arrive to see new member of the Bondi Vet team, Dr. Edward, with their two beloved King Charles Cavaliers.
Hi.
Hi, good afternoon. How can we help you?
We're here to see Dr. Edward.
Wonderful. Have a seat. We'll go on ahead and get it for you.
Thank you.
Of course.
They're extremely worried because 11-year-old Harley has been suffering serious intestinal issues, and lately he seems to be getting worse.
He hasn't been well for the past 3 or 4 months. Been from diarrhea to ongoing vomiting, and he'll get better and then he'll get worse again, and I would just like to figure out what's going on with him so I can get him healed.
Hey kiddo, you're not Harley, this is Stella. Hey sweetheart, look at
Here
you.
for moral support. And this is
Harley.
Harley.
This is Harley. Hey buddy.
He's sick.
Yeah.
We're hoping you can help us figure out what's wrong with him.
Absolutely. All right, well if you'd like to follow me, we'll have a chat. Michelle and Gaston are naturally really concerned. I mean, they've actually seen this thing progress to the point of where he's now almost as sick as he was when he first came here. Up to you. And we all want to get to the bottom of this and figure out what's going on so we can best treat it. All right, so let's get him on the table. I'll give him a check over. Hey, buddy boy, don't be afraid, eh? Hey, kiddo, let's have a look at ya. Hey, good boy. The fact that Harley's 11, it does warrant more concern than if he were a younger patient. Age is not a disease, but it's associated with diseases. That sounds good. And an 11-year-old dog with these symptoms, this is concerning. We are worried about more complicated things. Yeah, he doesn't really seem to have much of a bladder there. So what that reflects is quite simply that we're dehydrated. And that makes sense. I mean, if we're vomiting and we're not eating and we're not drinking as much water. But my big concern is to do with, of course, the stomach. And on the ultrasound last time, there was an area of the stomach which was thicker than what it should be, right? It's about 1.9 centimeters, which is, much thicker than it should be. So what I'd like to do now is I'll give him an ultrasound to check on that region of the stomach to see if it's still thick, and then from there we can decide what else we need to do. All right, Harley. Come on, Mr. Man, let's go. Good boy. Thank you. Ultrasound's a great way to have a look at the gastrointestinal tract, the abdominal cavity. It's quick, it's easy, and it's non-invasive. Sorry, little man, a bit of cold.
Hey, darling.
It's okay.
At Sash in Sydney, Lauren is spending some precious final moments with her much-loved Great Dane, Archie, before he undergoes surgery to remove a cancerous front leg.
If we've got the gift to be able to take away his pain, that's what counts. And yeah, we're gonna do this.
Good morning. Hi, Lauren. Hi, Archie.
It's a big care. Come on, Angel. Come on. I'm nervous. I'm feeling the vulnerability for him. He's my constant and my safety, and that's why this is so hard.
Thank you.
That's all right. We'll see you soon.
Come on, buddy. Come on, good boy.
Bye, Angel.
First, Archie will be put to sleep by anaesthetist Maya.
Do you want to drop that to maybe 1.6?
She's been overseeing the 6-year-old's pain control treatment during weeks of chemotherapy, leading up to today's operation.
My primary role in Archie's case is just to make sure that his quality of life is preserved. So for Archie, we combine different pain relief medications together. It's a lot to clip. Massive job.
As well as managing the anaesthetic process throughout the operation, Maya uses ultrasound images to carefully guide nerve-blocking needles into key areas of Archie's body. This will minimize pain during and after surgery.
1, 2, 3.
Specialist cancer surgeon Tristram will be responsible for removing Archie's front right leg.
We good now, my friends?
We're just having a look at the stomach now. There is concern for it to be something more serious.
In Miami, Edward's alarmed at the changes in Harley's stomach after the elderly King Charles Cavalier's bouts of vomiting and diarrhea recently worsened.
What I'm seeing is that there's a part of the stomach which is really thick. So it's much thicker than it should be. It's about 2 centimeters. And what that could represent, I mean, it's hopefully just inflammation, something like a gastric ulcer that we can treat through just medication. I am worried about Harley. There is that chance that it might be something more than just inflammation. Honestly, my mind can't help but go to something like gastrointestinal lymphoma or some kind of cancer. You know, hopefully I'm wrong. The concerning symptoms with Harley, for sure it's the weight loss. That's one of the bigger worries. The lack of appetite, the vomiting, the lethargy, it's all pointing to something perhaps more complicated than just a simple stomach upset.
X-rays will hopefully provide more answers.
We're looking for any evidence of spread of cancer, given that's one of our concerns with the stomach, as well as any kind of evidence of infection. He's been vomiting a lot, and a condition that can occur is when dogs inhale the vomit, they can get something called aspiration pneumonia. So we're checking for that as well. All right, so fortunately everything seems to be in line with this mass within the stomach or this area of thickening being benign. It's consistent with exactly what we're hoping for, a completely normal chest.
Edward's also checking Harley's blood to look for any more clues as to the little dog's deteriorating condition.
The white blood cell count is a little elevated, but that's to be expected. It's more inflammation than infection, so again, that's kind of what I was expecting, but it's only mild, so no worries there. This is very good news for Harley. So far, X-rays, blood test, it's all consistent.
Edward now has to update anxious owners Michelle and Gaston.
The ultrasound does look similar to last time, so the concern remains, you know, why is that stomach lining, why is it so thick? We're hoping it's inflammation, gastritis. That's something we can use medications for and it should be fine. But given how initially he was really sick, I think there's enough to warrant a surgical biopsy. What that means is we're going to remove a segment of that abnormal tissue to have a look at it under a microscope, and then that can tell us why is the stomach lining thick. We're thinking worst case scenario stuff here. All right, we'll get things sorted.
All right.
Come on, Mr. Man, let's go.
Thank you.
No worries at all. We want to decide, is this something benign, something inflammatory, or is it more something sinister? So what we're doing now is pre-oxygenating Harley so that when we begin to induce anesthesia, it's going to be as safe as possible. Good boy.
hopefully he doesn't jump or move.
In Western Sydney, Alex is struggling to get an intravenous drip into the ear of 6-year-old rabbit Charlie, who is dangerously dehydrated.
The vein doesn't look to be very good. Rabbits have very tiny veins on their ears, less than 1 millimetre in size. It's very tricky to place an IV cannula in such a tiny veins. And in Charlie's case, he's quite dehydrated, so those veins are absolutely tiny. There we go. Success. Blood glucose next.
Alex was able to carefully place the cannula into Charlie's delicate vein.
Very good job.
Alex is now checking Charlie's blood sugar levels. A high reading could indicate a deadly buildup of gas in his stomach.
11.1. That's a little bit high, but I think Charlie's a little bit stressed from being in hospital, and that's acceptable for him. If it was much higher, more than 12 to 15, then we might be concerned about a blockage.
Charlie is given medication to reduce the pain in his abdomen.
You take him down to...
Yes, I'll take him
Exotics ward?
to exotics, and we'll get him started on his drip.
Good job, Charlie.
Thanks.
Good job, no worries.
But there's one last vital thing Alex wants to do before beginning the rehydration process.
So we'll be trying to give him supplementary food, so it'll be like a blended hay diet that we syringe into his mouth every few hours to try and help get his intestines moving, because while they don't have any food, they're just going to be developing gas. It actually smells really good. It's apple and banana flavour. It actually smells really tasty. Hey, Charlie, yeah. Oh, there's a good boy. Look at him go. Good Charlie. Yeah. Look at him, he's almost drinking it. Good boy. Yum, yum, yum. I'm really happy that he's eating now, because when they stop eating, their intestines will just stop working. And if he enjoys it, that's even better. Hey, Charlie. Yeah. It's an encouraging sign that he's eating, but we're still in early days. We still need to correct that dehydration and then make sure that he's able to eat on his own without us having to syringe feed him that blended diet. So we'll get you into your accommodations over here, Charlie. Okay, Charlie, we've got your fluids here. So we'll just get you started on your drip.
It'll be a tense night of ongoing feeding and constant monitoring to see if Charlie's dangerously low fluid levels return to normal by morning.
Good boy, Charlie.
Because he's so large, it might be worth grabbing some larger sponges.
At SASH in Sydney, Dr. Tristram has made a positive start to the amputation surgery of Archie's cancerous front leg.
Excellent. People often ask us why we take the whole leg, given that the cancer is actually inside the lower limb. But the reason for that is that if he's not going to be walking on this limb again, there's no point in leaving any stump of the limb, because when the muscle atrophies away, it's just going to be uncomfortable for him. So we can make it much more comfortable if we take away the whole leg.
There is no upper limit for size for a dog undergoing an amputation. Even very, very large dogs like Archie can do extremely well. Their overall outcome in terms of their movement, their ability to return to exercise is just the same as if you were a small dog.
Interestingly, in dogs, the only attachment of the forelimb into the body is muscle, nerves and blood vessels. They don't actually have a bony connection because they do not have a collarbone. So different to us.
It's incredibly important that we don't cut into the axillary vein where it may draw air into the heart and lead to an air embolus, which can be immediately fatal.
This little instrument will allow us to cut and then seal blood vessels without suture. Like that, no bleeding.
The moment when Archie is separated from his diseased limb has almost arrived.
So we're just tying the artery now, so the pulse to this leg is now gone. So we actually watch his heartbeat. There we go.
Archie's front right leg is now gone. Hopefully, so have all traces of cancer from his body.
His prognosis with respect to his cancer, about 20% of dogs with his diagnosis do go on to live beyond 12 months and some years after surgery. While I'm closing Archie's wound, I need to pay careful attention to make sure there's no ongoing bleeding or oozing of fluid so that we don't end up with significant complications post-surgery.
Okay, there we go. All right.
I'm very, very happy with how the surgeries proceeded. We had no bleeding and the closure of the wound went very, very well.
Come on, Archie. Let's bring you out, buddy.
My expectation is that Archie is going to resume most of his normal activities as he could do on 4 legs, on 3 legs. Climbing stairs, running, jumping, playing at the park, and even playing fetch with a ball. All should be things that Archie can adapt to very quickly over the coming 2 to 3 weeks.
Gorgeous boy, hello.
Good boy, good boy.
In Miami, Edward's about to begin a biopsy of Harley's thickened stomach lining to try to pinpoint the cause of the little dog's worrying vomiting and diarrhea.
Okay, let's get him intubated. So what I'm doing now is expressing his bladder, so we want to keep it as small as possible to minimize its interference.
Suddenly,
It's not good.
Harley's heart rate escalates dangerously high.
His heart rate should be nowhere near this fast. It's about double what it should be normally, and we want to get it normal as soon as possible because he's already under anesthesia and we don't want to waste time. It is concerning. This isn't what we expect, especially given how there's no painful procedure going on right now, so we would expect a low heart rate. But the fact that we're high, we're just trying to piece together why that is and, of course, what we can do to get things normal again. Beautiful.
With Harley's heart rate now stabilized, Edward can begin the biopsy. Edward will be assisting lead surgeon, Dr. Rebecca Lynn.
Because Harley's growth is so thick, we can't really use an endoscope to go get a sample. So what we have to do is make an abdominal incision to actually have access to the stomach physically. I think there's a nodule at some point, but it looks to be benign.
I can't believe this poor guy can.
We want to get a representative sample, so we're taking a segment of this thickening to make sure we get an accurate diagnosis. Our concern is very much to do with the fact that the stomach is so thick. I mean, just feeling it, my mind immediately goes to the worst case scenario. This does look scary. So we're just finishing up Harley now. Unfortunately, it doesn't look good. The wall was really thick, much thicker than I was anticipating. We're going to be sending that biopsy away. We're going to be keeping our fingers crossed, but it doesn't look good.
Up, come on.
At Sash in Sydney, Alex is waking Charlie after a long night trying to get his dangerously low fluid levels back to normal.
Looking much brighter. Okay, let's have a listen to your guts. Just see if we can hear those intestines moving now. That's great. I can hear some gut sounds in there. Starting to make some good progress, Charlie. We do have some gut sounds now, and he is looking a little bit more hydrated. He still needs a little bit more time on the drip to correct that dehydration completely. So yes, it looks like Charlie is on the road to recovery, and I've got my fingers and toes crossed that he'll make a full recovery. Good boy, Charlie. Hopefully we can get you home soon and you'll be on the mend and back with Keith. How's that sound?
Hello.
Hi Keith, it's Alex calling from the Small Animal Specialist Hospital just with an update for you on Charlie.
Charlie's owner Keith has had a sleepless night worrying about the little bunny he loves like a family member.
So I've got some good news, Keith, so we can hear some gut sounds in there, and we've got Charlie on the intravenous drip and correcting his dehydration, and he has also started to eat. He's looking a little bit brighter. Keith's got a soft heart, and I think he's concerned and unfortunately lost a rabbit previously, so we're treating Charlie intensively. We want to make sure that Charlie can be reunited with Keith once he's more hydrated and eating and passing feces.
Okay, thank you very much.
Okay, fantastic. Bye-bye.
Bye.
Good boy.
All right, Arch. Hi, darling. Oh, yeah, no, Nicky. No, Nicky.
In Sydney, Lauren has arrived at Sash to take Archie home after the life-saving amputation of his front leg.
The main feeling is honestly gratitude for his spirit and the team and the care that he has had. So relieved for him. To see him relaxed and comfortable, massive relief. Good boy, Angel.
Yay!
Good boy. Good boy.
Good job.
Good boy, my love.
Rehab therapist Alana shows Lauren rehab drills Archie will need to do at home to get him back on his feet.
We'll encourage him to come up onto the step. Good boy. Good job.
Good boy.
So we're loading up his back legs because obviously they're going to have to do more work now. And we
Yeah.
want to do this sort of twice a day, ideally. We want to do about 6 repetitions.
Oh,
being
wow,
his goal.
okay.
He's
Yeah.
very eager.
Yeah. I'm blown away. He blows me away.
You ready?
He wanted to stand up hours after the operation, and he was walking the next day. It's just remarkable.
It's all right, we're going to do wheeze. Go to a wee.
So thank you. So thank you. He's teaching me so much. I have so much to learn from him. Good boy. Good boy. So I think humans have so much to learn from animals. And I probably underestimate how much animals just have the drive to get on with life and living. And that's totally what I've seen with Arch. You gonna come home?
Go see Nero. Yeah, see how he's doing.
In Sydney, Audrey and vet nurse Bree are making a house call to check on an unusual cat.
Off to see our little man.
I'm now excited to see you.
7-year-old Nero, who lives with his devoted owner Simone, has some unique communication skills.
Nero. Hey. I told you it's your day. I know. I'm an animal communicator. I do animal communication for clients. I also teach it for beginners, and all the students have fallen in love with him, and he tells them, I go, don't tell them our secrets. And sometimes he does, and they love it. We've got to have manners. What have I always said? We welcome people into our home, don't we? Thank you. Nero chats to me all the time, tells me what's going on in his world. I tell him how my day's been. I've got to go out. Where's my food? Come and feed me. Some people think I'm strange until they know that I do animal communication. They go, oh, that's what it is. But they'll, yeah, a little bit crazy.
Hi, Simone.
Hi, Audrey. Hi, Bree. Nero's waiting for
Oh,
you
is
too.
he?
Yeah.
Audrey has been keeping an eye on a number of ailments Nero is dealing with.
So how's he going with his arthritis?
He's going okay. He still has trouble walking a little bit, getting up and down. His arthritis really affects his personality. If we can't manage it, he's like a different cat. He's depressed, he's sad, he doesn't want to interact.
Okay, shall we get you on the table?
Okay, I'll put him on there
Yeah,
for you.
wonderful. Let's get started. So Nero is an interesting patient. He's one of my older patients with a lot going on. Like, what isn't going on with him? He's got a heart murmur, he's got kidney disease, he's got high blood pressure, and a really sore back. So I presume you've told him what I'm going to do to him today?
I have. Come on.
So I'm going to take some blood from his jugular and we're going to send that off to the lab. So we're just checking his kidney parameters. So I will compare that with last time and just see where that's sitting. And then also the blood pressure, which he doesn't like too much, but it's not painful. Just want to get a reading and hopefully that's back down to normal levels as well.
Whatever.
Is he saying whatever to me?
Whatever. It's kind of, you're getting the paw.
I'm like the paw. Mum is seeing a paw right now. So I'm going to take some blood from his jugular and we're going to send that off to the lab. So we're just checking his kidney parameters. Some cats will sometimes twitch when I feel around here, and that can be because of the arthritis. And we'll see what we can do about that.
Simone says when Nero is feeling better, he's constantly talking to her.
I am on call 24/7. It's like having my mobile number on as his hotline. Doesn't even matter. It doesn't matter if I'm on a call. He can break that call, stop it, and make me talk to him.
All right, should we get started?
Yeah, let's do it.
He's not very chatty today, but it turns out Nero's got quite a soft spot for Audrey.
Audrey's energy is really approachable, but not only is her energy approachable, Audrey's energy is grounded, and she holds the space for him. So that entices his trust. If you can get his trust, he'll nearly let you do anything to him. It's all right.
Let's get your little blood pressure cuff ready.
Lately, Nero's blood pressure has been on the high side, which could lead to organ damage if it's not kept under control.
So we've taken the blood from Nero and we've taken his blood pressure, and I'm really happy because his blood pressure's back down to normal. Sitting at 120.
Is that good?
120 is pretty good.
Thank God.
So he was up to the 200s,
Yeah, he was
which is
really
pretty
bad.
dangerous.
Yeah, I know, so worried.
Yeah, that high blood pressure can cause a lot of damage to the kidney itself, but also to every other organ that the blood runs through.
Yeah.
So that's one tick. The next thing is going to look at his arthritis. Shall we have a look at him walking?
There you go. Off you go.
Well, yeah, he does look really sore, just the way he's moving those back legs.
Okay.
Yeah. So arthritis is pretty painful for a cat because if it happens in that lower spine joint, it really makes it immobile. It's crunchy, they lose their cartilage and their lubrication, so it's really sore every time he moves to walk, to groom himself. I'm keen to make him more comfortable. We have to bear in mind that he has got a few other things going on, the kidney, the heart, the blood pressure. So I'm thinking of a supplement that you can add into his food, and it's going to provide him some comfort. It's actually made out of green-lipped mussels, and it's got all those omega-3s, which are good for inflammation and pain. It's got chondroitin in it, which is really good for cartilage health. So all of those things will help, and it won't affect his other problems.
Fantastic.
With the capsule, we're gonna break it open and actually sprinkle it on top of his favorite meal. So in Nero's case, that's chicken.
Oh my God, if he eats that, I'm gonna be over the moon. Oh my God.
So that's really great. That's exactly what we wanted. He loves it, just once a day into his food, and I think you're gonna see a huge improvement.
Fantastic.
So I'm hoping that in 4 weeks' time, Nero will start to feel a lot more comfortable. He continues to eat the supplement, which is good for him, and we get all his other problems under control. All right, see you.
See you next time.
Bye. You gonna wave the guy? Bye. See you later, Audrey. See you later, Bree. Bye.
Hey kiddo, let's have a look at ya.
In Miami, test results have come back after Edward biopsied King Charles Cavalier Harley to find out why he was suffering serious intestinal issues.
This does look scary.
Unfortunately, the tests confirmed Harley does have cancer. He is now receiving treatment for the condition from an oncologist. As for talking cat Nero, he's moving a lot more freely, and owner Simone reports he's a lot happier.
He can jump up and down the bed, sofa, and he's got quality again. As long as he's got quality and he wants to be here, I'm happy.
Hey.
And 4 weeks after his cancerous front leg was removed, Archie is adapting well to life on 3 limbs.
What are you doing? What are you doing?
Adoring owner Lauren is thankful for every new day she gets to spend with her lovable 6-year-old best friend.
You did it, Arch.
Hey, Rob.
Hey, Amy. Look at this. Look at it.
Oh my goodness.
In New South Wales, Rob and vet nurse Anne are urgently assessing 13-and-a-half-year-old cat Katie.
Come on, Katie.
The much-loved ragdoll was brought in by distressed owner Melissa.
I've got a cat called Katie and her abdomen's growing. We don't know what's wrong with her. So she's a big part of the family and I want them to do everything possible to save her.
Oh my goodness.
Yeah, and a lot of fluid in that belly.
Have we run any bloods yet or done any
Yeah,
ultrasounds?
I've done the bloods. Bloods are normal. I haven't done ultrasounds yet. I look at this enlarged abdomen and I'm worried about straight away heart problems, very likely. Could be cancer. It could be organ function that's failing her, or it could be some sort of bad virus. It's baffled me and I really want Chris to have a good look. He'll be able to tell us, I hope, with ultrasonography. So I want a specialist to be able to look for the real finer details that I could miss as a general practitioner.
Cool. Okay, so we're doing the heart ultrasound.
Rob's called in ultrasound specialist Chris, hoping the images will provide more clues about the baffling build-up of fluid.
One possible cause is heart disease first, so we're starting with if we can look at the heart and see what that is here.
Yep.
That looks to be fine.
So Chris is looking at the heart and looking at the aorta and all the major vessels. There's nothing there, it's all normal. Scanning the abdomen, it's all normal.
So this is a bit of a tricky one. It's not going to be as simple as one test will give us one answer.
We can't work out what's going on. Yeah, we're in trouble here.
We'll pop him on the scale.
Okay, look at him, really cute. Hi.
In Sydney's West, it's another busy shift at the Small Animal Specialist Hospital.
He's trying to get up. He's
Don't
really
try and
sweet.
get up.
As one patient gets settled, another arrives that needs Mara's immediate attention.
Oh my God, look at you.
Yeah.
Hello. Hi. I've got sweet little Nova here. Cutest little staffy that I've seen in a while. Oh no. How are you? Are you hungry? Poor Nova came in because the owners came home and found that she had a wound on her foot and was hanging on by a thread. So they wrapped it up to try and make sure that it wasn't going to bleed all over everything, and they made their way in here. Oh my God, and you've got bling too. Well, let's make sure everything else is okay, and then we look at your foots, okay? I love that she comes with her name on her. It makes it much easier.
I know, I was like, this is Nova.
Are you Nova? We love Nova. Your heart and lungs sound very good. All right, you ready? We're gonna do the big reveal now. Can I have your scissors? Thank you. Okay, prepare yourself. They did a very nice job covering this up. We just want to get this off without hurting you. Oh, you sure did cut that.
It's a flap.
Can I look a little better? Oh yeah. How did you do that? You tried to actually rip your pad off. You poor little thing. That can't feel very good. The wound is not good. That paw pad is not hanging on by a thread, but it's definitely trying to come off the foot. So there's some significant damage that I'm gonna have to work on. So I think, my friend, you're gonna probably have to be asleep for me to get a really good look at this. All right, well, we will do just a nice little temporary bandage just to protect things until we can get stuff going for you. You are the bravest little friend.
Because the injury is so painful, Nova will need a general anaesthetic for Mara to get a close look at the badly ripped paw.
All right. So brave. Do you want to go back down on the ground? Oh my God. She's solid. You're so solid. She keeps flattening down. Come on, Nova. You keep flattening down like a badger.
Yeah.
Ooh.
Yeah.
Despite her injury, it seems Nova's not happy she is missing out on her daily exercise.
Poor Nova was so excited because the owners put the harness on her, and she's like, yes, it's my evening walk. Life is great. Denied. Alas, she gets to come to me instead. You can do a walk tomorrow. Don't hate us. We do this to everyone.
of fluid, isn't there?
In outer Sydney, Rob is still baffled by the massive buildup of fluid in ragdoll cat Katie's abdomen.
This is going to be a frustrating one because it leaves us with a little bit of an open diagnosis.
With the ultrasound results inconclusive.
More investigation needs to be done. So we'll get some fluid out today and send it off to the laboratory. We're going to take fluid out of the abdomen and send it to a pathologist who will look at it and find out, are there cells there that might give us an indicator, like cancer cells? Come on, Katie, say thank you.
With the sample heading to the pathologist, Rob's now going to drain as much fluid as possible to make Katie more comfortable.
Some people like to sedate them at this stage. Right at the moment, I don't want to take the risk. She's already compromised with that diaphragm, with the amount of fluid there. So if she lets me, I will just take the fluid out without any tranquilization.
Good girl, Katie.
Good girl, Katie.
Sweetie.
Nearly better.
You've been so good. You've been so good. Come on. You'll feel better.
Can't believe how much is coming out. It just keeps pouring out more and more and more.
700 mils and counting.
You can see her tummy's come down a lot. That'll do. We haven't done it all, but that'll make you comfortable. We're up to 800 mils, but she's getting a little bit uncomfortable with everything, so we'll stop now. I'm going to send her home with Melissa. We'll get the results back at pathology, and then we've got to decide on the next step. Good girl, Katie.
So brave. Oh, who's the bravest?
In Western Sydney, emergency vet Mara and nurse Jess are giving 1-year-old Staffy Nova a general anaesthetic so they can find out how badly she's injured her front paw.
Okay, time to see how this looks. Ooh, this is going to be challenging. Okay, so we've got this whole half of the pad. She tried to cut it right off. Ouch. She sliced along the lateral aspect of her 4th digit. And I am not sure if I'm going to get this flap of skin to attach really easily. A lot of times when I see a wound, it's because the dog or cat has gotten their foot caught on something nice and sharp, like a piece of glass, a piece of metal. Those are the best ones because it's a nice, simple, smooth line that I just have to stitch together and life is good. Wow, this is going to be quite a job. Okay, baby. Nova decided that she wanted to do something special and tear her paw pad off. I don't know if she got it stuck on a nail or what. Ooh, you tried to go down to the bone. Monkey, you really did a job on yourself. All right, you happy to clip? I can hold the leg for you if you'd like.
Mara faces a huge challenge, trying to somehow repair the shocking injury.
We know that if people do a lot of damage to their heel, they may never actually fully recover from that type of injury. And I don't know if I would be able to stick an entire paw pad back on and actually have it be viable. Taking any breaths, darling?
Adding to Mara's concern, Nova isn't breathing normally under anaesthetic.
Blood pressure's good. Our friend is just still very deeply asleep and so not taking very many breaths on her own.
Muy bien, Teo.
In Miami, Edward's first patient is arriving, fluffy 3-year-old golden doodle Teo.
Hi, is Dr. Edward in?
Yes, go ahead and have a seat. I'll call him for you, okay?
Thank you.
A short time ago on a walk, owners Tadeo and Carson suddenly became alarmed.
I'm a little worried. It's the first time it's happened, and it happened randomly. She noticed that his pee color was a little different. I'm hoping it's not something that he ate and has some sort of cuts inside that could be potentially lead to any other things other than the blood.
Hey, good afternoon. How's it going?
How are you, Doctor?
Good to see you. All right, you good? All right. Hey, buddy. How you doing? I love your haircut, mate. Hey? You're more well-groomed than I am, I'll tell you that much. So, what's he here for today?
We noticed he was peeing like a really dark brown color, and we're worried there's blood coming through his pee. So
right. Alrighty, let's get him checked out.
Perfect.
Right through here.
LinkedIn.
This is naturally concerning because what it could mean is severe inflammation or potentially bleeding. I know, right? It's hot, hey? It's Miami. The first thing we're going to do for Teo is to give him a head-to-toe check over. Lungs are nice and clear. We're going to try and find clues as to what exactly could be going on. More importantly, how can we fix him? A little bit of inflammation going on there, nothing major.
He does get ear infections.
Probably something like a skin allergy, you know. Wouldn't be related to the whole urine issue we're dealing with right now.
Okay.
And I can see that on his fur there's like this sort of brown tinged urine. He's otherwise been totally fine, so that would suggest the problem is very much limited to just the urinary bladder. That's a good thing. You know, we want to have something like cystitis, which is an inflammation of the bladder. That's probably one of the best causes you can have for blood in the urine. One of the other things I have in mind here is because we are an entire male, so we're not neutered, that can predispose to prostatic disease. So the prostate, it can be inflamed, it can be infected, and these things can cause similar symptoms, specifically, you know, bleeding into the bladder itself. First things first, let's get a urine sample. Let's see if there's bacteria, let's see if there's any kind of crystals, any clues as to, you know, what is actually causing this. And then we might also want to have a look at the abdomen itself, specifically the bladder, the kidneys, and the prostate, and we can do that really well with an X-ray. So I think that's the most sensible course of action for him.
I'm a little worried about the fact that he's like not neutered because it poses a lot more possibility for risk. So hopefully it's just a urinary tract infection and not something like more serious.
Best case scenario stuff, all we see is just the bladder's perhaps got some bacteria, and in which case we just treat with antibiotics and, you know, we'll be right as rain. But of course, if we see anything else, if we see like maybe the prostate's a little bit more abnormal, then we can take a closer look and, you know, do what's best for him.
Okay.
So
sounds good, doctor. Hopefully it's something simple.
This is probably going to be messy. I'm just going to do buried sutures as well as surface sutures.
At Sash in Western Sydney, Mara is about to start trying to sew up Nova's severely lacerated paw.
Still hasn't taken a breath on her own that I've seen. So
she just did a little one.
Okay, fabulous. You're breathing now on our own.
Everything is good. Blood pressure is good. Perfect.
Nova's erratic breathing has now stabilized, and Mara can now start tackling the complicated injury.
Okay, you gotta go. Thank you. All right, time for some beautiful chunky stitches. The paw pad, it's a very sensitive area. It's what basically is holding all of the weight of that dog when she steps on it. And so we need to make sure that we can get that paw pad back together. I think I'm gonna start with the pad itself first, and then I'll move on to the wound here around the toe.
Okay.
I am basically having to change the location of every stitch that I make because it's like putting together kind of a puzzle, but it's a damaged puzzle. So you're often placing stitches almost blind, and then you're just kind of crossing your fingers and hoping that it will work.
Every stitch is a challenge, so Jess must hold the little dog's leg perfectly still.
My hands are okay, but my legs are starting to feel a bit stuck in the same spot. If the wound was positioned differently, then we could sling it up and not have a nurse hold it. But because it's in an awkward position, it's just better to do it this way. It's just trying to keep it as steady as possible for Mara.
Thank you.
But despite the difficulties and her earlier uncertainties,
I think I'll be able to get most of this back together okay.
Mara is now confident she'll be able to get Nova back on her feet again. All four of them.
Yep, one more, and then we're done.
Easy.
At first, I mean, it's a pretty big injury. It kind of punches you in the face, and you think I might be here forever trying to get this put back together. So, good news, we can have a functioning paw pad in the end. All right, done. Let's not the most beautiful of things. It's like an angry porcupine, but it will work. Considering how ugly it was, this is a whole lot better.
Oh yeah.
The real test will be if Nova is able to walk on the repaired foot once she regains consciousness.
You turn the ISO off now?
Yeah, turn the ISO off so she can start waking up.
That's great.
In Sydney, it's time for Katie's worried owner Melissa to find out the test results on the fluid that was drained out of the 13-year-old ragdoll's abdomen.
The last few days have been quite tough, not knowing actually what's wrong and having a diagnosis. Yeah, I'll do anything for Katie. Once I know, at least we can come up with a plan.
Come on, Katie. I've got a result on that fluid that was sent to the laboratory, and it's got some cells in it which they don't like. They don't know what the cells are yet. The pathology gets us a little bit closer, but doesn't give us a diagnosis. I was hoping it would. It says there are a small number of cells which are atypical. What that means is they could be cancerous.
Okay.
I think it's time that we do surgery, have a look inside once and for all so we can get a diagnosis and then a plan for the future for her, however long that may be.
Let me know as soon as possible.
I will. Straight after surgery, I'll give you a call now.
Yeah.
I need a diagnosis so I can work out a treatment plan long term for this cat. Okay. I hope I don't see a lot of cancer. That's my big worry. Another suction, please. We're going to get quite a bit of fluid out, I'd say, on this. So I've got to get all the fluid out before we can really see anything. Seriously, you wonder how this can be. 48 hours ago, we removed a litre of fluid, and now we're filling up the suction machine all over again.
Are you happy for me to empty that?
Yes, please. No, empty it. That lining there on the abdominal muscle is called the peritoneum, and it's not a healthy lining. This is all very, very wrong. Lesser omentum, and it looks like it's almost being attacked by something. The omentum is a lacy type of material, often referred to as the plumber. If there's any leakage anywhere, it'll go there and block the leakage up. It's like a cobble road. Truth is, in my heart of hearts, I think this is going to be a cancer. Okay, we've got the sample. Let's sew her up and get out of here.
Melissa speaking.
Hey Melissa, so she's okay. I'm still operating on her. We did find some abnormalities. I can't get them all out, but I can get enough to get a specimen to send to pathology. I've probably.
Do you think it's cancer?
Yes, I do.
Yeah, okay.
I do. I hope not, but I do feel that's what we're going to get.
What if it is cancer?
My job will be to keep her happy for as long as possible. We will go through this together, kid. We'll just do a step at a time.
Okay then, thank you so much.
All right, Melissa. No worries. All the best. So we will try and keep them as long as possible together. We're going to try and drain fluid. If it comes back again, we'll put her on some medication to try and stop the build-up of fluid and just keep her pain-free, happy for as long as possible. That's a good girl, Katie.
I don't want the toes exposed because I want everything to be kept as close together as possible.
In Western Sydney, Mara and Jess have finished surgery to repair a badly cut front paw on 1-year-old Staffy Nova.
Any tension is going to start to make the sutures pull through the skin. Now, yeah, we don't want to have that. That hurts.
But Mara can't be sure how successful the operation has been until Nova wakes up and begins walking.
I hope she can tap dance. Soft shoe instead of regular tap. All right, baby. We are all done with you, Nova. It's time for you to wake up. No more ouchy foot, hopefully. We need to make sure that we have a functioning paw pad Because otherwise Nova's going to be in pain for the rest of the time that she's trying to walk. Wakey, wakey, time for eggs and bakey. Hello. Do I need to wake up enough? Yes, can you wake up enough for us? If you wake up a little bit more, you can go on a walk. Hi.
Nova is slowly regaining consciousness.
Hey, Bubba. Hi, cutie.
With Mara keeping a close watch of Nova,
Good girl. Ooh, good girl.
in no time at all, brave Nova is up and walking comfortably on all 4 legs.
Oh, that looks nice and normal, paw. Good job. You are a good girl, Miss Nova. I'm very happy with that. And then we're just going to hold on to her for the night to make sure that her pain is well controlled, that she's walking comfortably, that everything's looking good. And then she's going to get to go home. And hopefully she'll be comfortable for the remaining time for her to heal. Oh, Miss Nova, you are a good girl.
First things first, let's get a urine sample. Let's see if there's bacteria, let's see if there's any kind of crystals, any clues as to, what is actually causing this.
In Miami, Edward needs to urgently find out why 3-year-old Teo has blood in his urine.
Do you want me to take the front? Do you want me to take the whole thing? The size of Teo does make it a bit of a challenge, especially when we're trying to, lift him up onto a table. Oh, are you okay?
Yeah, I'm okay.
He's a gentle giant, don't get me wrong, but he weighs half a ton, so, you got to lift with your back. Atta boy. Right now we're getting ready to get the urine sample, and we're going to get the sample using this needle, and we're going to guide this needle into the bladder using this ultrasound. So of course this is concerning to see it. Normally what we should expect is for the urine to be normal in colour, yellow, but what we have here, it's distinctly red. So this does reflect quite a lot of inflammation going on with the bladder itself. So naturally we want to figure out where this bleeding is coming from and fix it. Let's get him over to X-ray. I got him. Oh, there we go. Good boy. The next steps for Teo is to get imaging done. Whew. We want to pinpoint the cause, and we don't want to go into this blindly. We want to find a specific thing we can treat. 1, 2, 3. Oh, good boy. So what we're going to do is get left to right lateral and BD. At this point, I'm worried about a lot of things. The fact that he hasn't been neutered does increase the risk of certain things like prostate problems. Aside from that, it's even possible we might be dealing with a bladder cancer. I mean, there's a lot of inflammation or bleeding going on, so we need to figure out what's going on here. All right, let's have a look at Teo's x-rays. Right now, I'm looking for any evidence of bladder stones or a suggestion that the prostate might be affected. Fortunately for Teo, there's no evidence of stones. This is good news, this is great. I mean, it's what we're hoping for. Of course, the last thing we want to do for poor Teo is surgery. So I'm pleased to say this is looking more of a medical case, and that's going to be the next step, is to look at the urine to see what kind of clues we can get there, along with a blood sample, and then we'll have a complete clinical picture of Teo and more importantly, what we can do to get him feeling better. Good boy, in you go. Good boy. Well done.
In Sydney, an anxious Melissa has arrived back at Rob's practice to collect her beloved ragdoll Katie.
The good thing for me now is that I can reunite Melissa and Katie, and Katie can go home and have some quality time at home.
Katie.
Here you go, to your mummy.
Hello, sweetheart. Hello. Hello. It's really great to see Katie again. Just missed her all day and worried about her. A bit devastated that it could be cancer, but at least we know now we can treat her. No, sweetheart.
If you look at the tummy,
yeah,
it's down at the moment because we've been inside there.
Oh,
and got rid of all her fluid for now. We're able to get a sufficiently large portion to send off to pathology, so we can see what we're dealing with.
Okay.
I'm hoping that with palliative care, we'll be able to help her if I'm right that it is cancer. I'm hoping I'll be proven wrong by histopathology. Very confident this will give us a final diagnosis and then a treatment plan from here.
Okay.
I'll go and get her crate so she can go home.
Okay, thank you.
I'm glad I'm taking her home. I just have to wait and see what it comes back as and treat her for it and make her comfortable for the day she has. Could be months, years, I don't know. Baby, it's all right, Papa. It's all right.
Good boy, Tio. Good boy, look at that. Nice.
In Miami, Edward is carrying out a series of tests to try to find out why Teo has suddenly started urinating blood.
Good boy, matey, good boy.
Owners Tadeo and Carson are nervously waiting for news of their beloved boy.
He's probably feeling a little bit anxious. He is a little bit of an anxious boy, like when he's in places that he doesn't know, around people that he is not very familiar with. I'm hoping it's just a urinary tract infection, like that's simple to handle and not something more serious, like a cancer or anything like that.
Okay. Blood's looking good. There's no real abnormalities seen on the blood work, which is fantastic. The kidneys are good. We want to see that, especially in cases of such severe inflammation. When we're looking at the urinalysis, there is bacteria present. So this is looking consistent with bacterial cystitis or a urinary tract infection. Overall, this is fantastic. I'm pleased to say Tio shouldn't need anything more than just a course of antibiotics. So Tio can get back to normal. Come on, buddy. Good boy this way. Good boy. You know the way. He's on it. Tadeo and Carson are going to be relieved. I mean, you know, when they came in, you can see it on their face. I can't wait to give them the good news. Here he is. He's ready.
Sí, mi gordo. He wants to leave.
Good boy. Hey, there we go.
Muy bien.
Alrighty, so things are looking good. The only concern I have is the amount of inflammation, and I got a urine sample here to show you guys. It's pretty much what you saw earlier.
Yeah, like dark brown.
That degree of inflammation. That brown is red blood cells that have oxidized, and so that's why we're seeing the color we're seeing. So again, the question is, why is there so much inflammation? We were worried about things like, is there a prostate problem? Are there bladder stones? Really pleased to say that everything so far is in line with just a bacterial infection, which is kind of the best thing we could hope for in terms of, you know, what could be causing this amount of inflammation. We're going to get him on a really good antibiotic for problems of this nature. We're going to get him some pain relief as well to help alleviate that kind of discomfort he gets from all that inflammation. And that's pretty much it.
I'm just glad that it's not something more serious. Yeah,
exactly.
I'm happy it's just an infection.
Exactly, exactly. More importantly, let's get this poor guy home so he can get some rest.
He's probably tired.
See you, buddy.
Dile chao, dile gracias.
Hey.
Muy bien. Yeah, I'm feeling very relieved that the doctor told us that he only has an infection and something more serious with anything else, so. Muy bien, Teo. Dr. Edwards was great. He walked us through everything, you know, what they were gonna do, what the possibilities could be of what Teo had. So I'm really glad that he was here to help. Thank you.
I'm so excited. I can't wait.
In Melbourne, Danny's on the road today, meeting with a friend who has a special relationship with animals.
Down, please. Charlotte, you're a good pig.
Lauren trains animals to perform in movies and TV shows.
You'll do the big one.
Hey Lauren, how are you?
Danny, I'm good. How are you?
Yeah, good, thanks.
That's
this is our little
good.
patient today. You are so cute, darling.
Lauren's called Danny because one of her on-screen stars, Larry, has developed a problem with his eye.
So aside from the eyes, is there any other concerns?
I was just looking at his nails thinking that they need to be done.
Oh, do they?
Yeah.
Oh, I think we can get that sorted. Well, let's go have a little look at your mate, hey? So if you look on the conjunctiva under there, it's a little bit inflamed. So there's no squinting or anything going on. I think for now, we could just try some antihistamine eye drops to see if that settles it down. But if not, we'd want to do some little tests on the eye just to see if there's anything else going on with them.
Okay, no worries.
Okay. All right, let's clip those nails, sweetie pie. Sorry, yes, we've got to. Has Larry been in any films lately?
Yeah, he just finished on a big one last week. He was on it for a few weeks,
Little
actually.
superstar. Yeah. All right, I think your nails are all done there, mate. Yay! Ah, all done. All done.
You were very good.
As well as starring in movies, Lauren's menagerie of animal actors also play another important new role.
Oh, there we go. Good job.
Lauren recently started an animal therapy program for special needs children and has invited Danny to join in.
I've heard so much about them, so I'm really excited.
Other way, Ross. Here we go.
Oh, darlings. They say never work with animals or children. They couldn't be more wrong.
Yay! Good job, Chandler.
How do you find the animals make you feel when you're around them? Yeah?
And my heart is full of love for them.
Oh, that's a lovely thing to say. Something about animals, I think. Yeah.
Are you ready for Romulus?
Yeah. Hello.
Ooh, he's your friend.
Oh, that's the sweetest thing in the world.
Liam's been coming here every week. Not a lot of people would find this a calming activity, but Liam does.
What is it that you love about Romulus so much, Liam?
He's such a big bird, but he's so friendly.
I think he trusts you too.
Oh.
Oh no. No. I think he's got his favourite.
Oh, good job, Liam.
Watching Romulus and Liam together, the bond they seem to have and this connection and understanding of each other and the calm that came upon them both, it's truly miraculous. You're number one, Liam.
The animals to me have always created magic, so to then be able to see it go on to these children, there are no words. Oh, well done, Tanner.
Nice. Woo!
Well done. Good job, Danny.
Tanner, you are way too quick. This is a lot harder than you make it look. Look. I'm so embarrassed. Oh my goodness. And do you have a favourite animal?
Probably dogs and reptiles because I love them since childhood, so they've always kind of been there and I've always loved them. Yeah, very therapeutic.
I want to come hang out here every week too.
Who wouldn't?
I know, exactly. Good job, you guys. Well done, both of you. Most of my life is devoted to the care of animals and looking after their health and well-being. It really is nice to be reminded that animals truly do have the power to heal us. Thank you so much for such a rewarding day. It was just beautiful.
Oh, thank you for coming. The kids loved having you.
Pleasure. Oh, I've got to get going, little Larry. Let me know how you go with his
Yeah,
eyes,
I will.
okay?
I will, absolutely.
All
Thank
right,
you.
See you later, guys. Bye.
Bye.
Say bye.
1 month after Katie's surgery, Rob has devastating news about the much-loved ragdoll cat.
4 weeks after the surgery, Katie passed away. Katie was such a beautiful cat and so important to me. Emil loved her so much, but the cancer was really surging inside her abdomen. Mia enjoyed the few more weeks that she had with Katie, but that was really tough.
But there's good news for Mara's patient Nova. The brave Staffy has fully recovered from that nasty ripped paw and is back running around normally.
That is good. So yeah, so there's like a little bit of free fluid right there. You see how there's almost like...
At Sash in Western Sydney, it's a super busy Friday night for emergency and critical care specialist Mara and her team.
Friday nights get really busy in emergency, but generally what happens is reg vets close for the day and then animals start to get sick, and that's why we're here. Probably going to need broad spectrum antimicrobials very, very quickly. Sometimes it's just a continuous, another patient comes in, another patient comes in. They're relatively stable, we can do things in a stepwise fashion and life is good. I mean, you do what you have to do when there's a big bleeding wound. It is better to get it to stop than not. You've got stuff coming out of the drains and falling from the ceiling on you, and animals being rushed in one after the other. And you are trying to literally back and forth, deal with 2, if not more, patients at the same time. Oh, Lord. Oh, baby.
And more patients keep arriving.
All right, your job besides that is going to be to check the temperature every 5 minutes or so.
Hi,
Mamacita.
My name is Pippa.
The newest one is Cocker Spaniel Pippa, struggling with a difficult birth.
Hello, gorgeous. Oh my God, you are so cute. Who's so good? Okay. Did you have babies? And they're not well? And we need to check you out? She had 2 puppies earlier, and they both died. And we don't know if she has any more inside. I might need another person. I think our mama girl is going to be a little bit wiggly. I really need to see if the puppies are there and if they're alive or not. Should we see if you got more babies in there? Should we check you out? Let's check you out. Sometimes we have dogs that just stop their labor. That's not a normal thing to happen. There's usually something bad going on. It may just be that the uterus itself is exhausted. So, looking to see, there's at least 1 skeleton inside. Important question is there a little heart beating in there? I'm just trying to get to her chest, see if I can see a heart beating or not. And you are a little anxious, lovin'. I don't think I'm seeing a beating heart.
There she is!
At the Australian reptile park, alligator expert Billy and his team are on a dangerous mission.
Come on! So I'm going to call the gators. Yeah. Come on! Yeah.
At the end of a particularly brutal breeding season,
It's hardcore. Watch out.
it's time to round up any wounded gators.
So this one over here is the one we actually need to catch, half-tail, the one we're targeting today.
One gator in particular, Halftail, has been spotted with a nasty injury.
Halftail has been our most dominant female alligator out on the lagoon here for like 15 years. And she originally lost half her tail, hence the name, in a big fight with another female. Look at those teeth. She's been involved in a pretty hardcore fight with one of those girls. Far out, that looks nasty. The other female's bitten off part of her jaw. She's literally watching us right now.
But to reach the wounded female, Billy and his team have to deal with some of the aggressive big boys first.
Just watch, we've got a big male coming in right here. That looks like Ivan.
No wonder Halftail is playing hard to get.
Hopefully we can get her. But she's just spooking a little bit at the moment because of these big boys.
The massive male bullies aren't moving out of the way without a fight.
One in particular, Ivan, I reckon we've got to catch him. And I reckon once we get him out of the way, we're going to have a better shot at her. Come on. Yep, good. Just watch that post and move past. I'll try and get him out. Come back this way. Now go around. 3, 2, 1. Hold up. He's too heavy, we can't get him up. You know, straight to this. Try and pull it off here.
I don't think I'm seeing a beating heart. There. Oh, you good girl.
At Sash in Western Sydney, emergency specialist Mara is anxiously searching for a heartbeat, hoping that Pippa's unborn puppy is still alive.
Girl. I just need to see if your baby's okay.
The Cocker Spaniel was rushed to emergency after she delivered 2 deceased puppies at home.
Ah, beating heart! Heck yeah! One baby's alive. Okay, let's see if we got more babies. It can be hard to know how many puppies are there based on ultrasound, but one thing that ultrasound is really good at is it can help us see if the heart is beating and if the heart is beating fast enough or too slow, which can let us know, is it appropriate to do medical treatment. You see that flickering in there just to the left of the screen? You've got a live baby and that heart rate is a good heart rate, so that is good. Good job, good mama. Yeah, you were very brave. And look at the rest of you then.
With a 3rd puppy potentially in danger, Mara urgently needs to find out why Pippa's labour isn't progressing.
So we've got at least one baby. who's healthy, as far as I can tell, which is good. We'll just have to see.
That's good news.
Why she has stopped passing her puppies out. Look at how big your paws are. They're gorgeous. You know that? All right, sweetheart. You need your hind end. Perfect, thank you. Okay. Oh, you're doing a vaginal exam so that I can see if her cervix is still open. It is. And she's not doing any muscle movements in response to this, and if she was in active labor, I would expect. But I can feel something. Are you thinking of trying to get a puppy out? Sometimes we can have other things that can affect the uterus's ability to be able to contract and basically push the puppy out. So sometimes our patients have a low blood sugar level because they're just exhausted and don't have any more energy. Sometimes their calcium level is low, and calcium is actually an electrolyte that's really, really important to help muscles contract anywhere in the body. Mamacita, your calcium's a little low. But we can fix that. We can fix that. Yes, we can. And then we give oxytocin, which is a hormone that is used in women when they are induced for labor, and we use it with dogs. Basically, what that does is that triggers the uterine muscle to start contracting. Oxy in, calcium in, all good? Yay! Mama, should we get you settled somewhere nice and cozy? Okay, you get to bed.
If the oxytocin doesn't work, Ma is concerned that Pippa may need emergency surgery to get her puppy out safely.
So it's a lot more invasive doing the surgical approach, but sometimes that's what you need to do to try and get live puppies out. Yes, I know, Mama. And get a little live puppy out sooner rather than later.
Ready? Come on.
In Sydney, elderly dog Zena is in the wars, struggling with an extremely painful sore foot.
Zena is a rescue pup. I've had her for about 10 years and I got her when she was about 3 or 4 months old. She was found with her mum and a litter of her siblings under a house in Walker somewhere. Yeah, she's been with me ever since and yeah, love her to bits.
Zena's owner Bonita is bringing the 10-year-old Great Dane boxer cross to see Audrey to check a nasty growth on her paw.
Hi, Bonita. Hi, Zena, my old girl. How's she going?
Yeah, she's all right. She's a bit sore.
Oh, you look like you have a sore foot there, all bandaged up. Well, let's have a look at it. Come on in.
All right. Let's go.
Limpy, limpy. All right, come on in. Have a seat. All right, check it in. Let's see what's going on. I can see that she's limping on that leg. It looks very sore.
Turn around.
Turn you around. Turn around. Okay. All right, so what's been going on with this foot?
She had a lump on there that I initially thought was an infected cut, but over the last probably 2 weeks it's grown sort of exponentially.
Okay. How much do you think it's grown?
Oh, quite a few centimetres, yeah. And it initially looked like just one toe, but I feel like it's 2 toes are quite swollen now.
Two toes are quite swollen, yeah.
From what it looks like, yeah.
Because obviously when you get a little swollen lump, it could be something like a graze or a cut or grass seed or something like that. But if it's growing that quickly, then your concern changes a little bit as to what it might be.
Yep.
So I'll take that lovely bandage off that you've done such a good job doing and have a good look what's going on. To hear Bonita say that this small lump has grown by centimetres, that's huge when you're talking about a toe, because every centimetre makes it harder to remove or do anything on that toe. Oh wow. Oh, I know it's sore. Oh, let me have a look at it first. All right, so just looking at it, it is huge. It's obviously bursting and very sore because there's not enough skin there, but it does look very fleshy. And I'm feeling the third toe here and the bones actually feel okay. So for that reason, I think it's a really good idea for us to do an x-ray because I might be able to save that toe. We might not have to amputate it. It may just be resecting the mass off. I may not get clear margins, but at least maybe we can have a chance of saving the toe.
Yeah. Whatever it takes.
Yeah. Because Zena is an older dog and a large breed dog, general anaesthetic is risky. We've got to do a few diagnostic tests before I get a good plan of what we're going to do, so we have to move quick. All right, Now we've got Zena asleep, I can have a really good look at it without hurting her. And it does look very fleshy. You can see where she's been licking and it's all red and raw. But there's definitely almost like this fleshy tumor or something that's just sticking out of this third toe. But what I really want to feel is if the bone underneath is affected, and that actually feels quite good. I can feel the bone sitting on top of the lump, and it just feels like the lump is coming out of the tissue around it. Okay, so I'm just going to take a fine needle aspirate of this lump. So that's where I stick a needle in and pull back on the plunger to grab some cells from it, and then we'll spray it onto the slide and look down the microscope. And hopefully that will give us a better idea as to what it is. And it does feel very soft.
She's right there where those bubbles are coming up. Do you see that? Yep.
At the Australian Reptile Park, after a ferocious alligator breeding season, Billy and his team are trying to capture one of the casualties, injured female halftail.
Just spooking a little bit at the moment because of these big boys.
Halftail will have to wait. Some of the big dominant males have moved in close, so Billy's rounding them up and checking their wounds first.
There's a big Ivan coming in. Yep, keep going, keep going. He's too heavy, we can't get him up. He's gonna roll, he's gonna roll. Ooh. Ivan is just full of absolute raw power. He looks like he's gonna actually start rolling. If he rolls, we're in all sorts of trouble. He's coming. Go, he's going. Pull. 3, 2, 1. When you see the size of these boys, you can see the power that's coming out of them. It's insane. Let's go, get in it. You can only imagine what they're doing to each other in breeding season, which is why today is so important. So keep that pressure on. Go. 3, 2, 1. There's that other foot, Bill. It's sucked into that mud. Go, pull. Go, get it, pull. He's too big. He's too big. We just need to get him another 2 feet and we're good. Righto, pressure on. Again, 3, 2, 1, pull! Okay, here with the right tree. That'll do. The tree. Come around this. I won't go over, Jill. How's the size of this bloke? He's got to be close to 4 metres. We've got paint, everything ready?
Yeah, paint's just coming at him.
I'll just see what he does before you jump on, Mitch, just because of the water. I'm a bit nervous. 3, 2, 1. Jump on, Mitch. Check to make sure they've got a microchip. If they don't, we give them one.
Billy, we've got 2, 3, 4, 5. It's Ivan.
Oh, beautiful. Just make sure that pressure stays on that rope.
He's building.
Watch those back legs. Overall, pretty good result.
Lethal Ivan has survived the dominance fighting unscathed.
Pass me the paintbrush, please. We need to know who we've caught, so we actually just put a little bit of paint across the back of their neck. Adam, you want to start loosening this rope. Give me a bit of...
This is a scary part, removing the top jaw rope and freeing an angry killer reptile.
So Mitch, you're good to go.
Yeah, man, I'm ready when you are.
More rope, Adam. Go. Done? So Halftail's still out against the snags over the back here. I reckon she's shy because this big fella's still against the ramp, so she's the one we actually need to catch.
Because we are at capacity at the moment. How's that one doing?
At the busy emergency department at SASH in Western Sydney, pregnant Pippa has suddenly started showing signs of labour.
Gloves.
And Mara quickly swings into action.
Hi. Okay. Looking in, I see there's this puppy completely enclosed in the sack with everything still attached, not moving, looking like it's dead. Okay. Yes, scream at me. Scream at me. Get mad. I know that I've got to try and do anything I can to see if I can save this puppy. Guys, I need oxygen. trying to get its airways clear of fluids. My goals are the same for any patient that comes in unresponsive. I'm looking at the ABCs. So do they have an open airway? Are they breathing on their own? And is there evidence that their heart is beating? Can someone get me a new towel, please? I'm trying to get oxygen into the puppy either through the oxygen mask or even doing a little bit of blowing directly into its nose with my mouth. All right, if you could go into the crash cart, please, and see, open up a vial of adrenaline and just get me a little bit in a syringe because I'm going to give our friends a little drop of adrenaline. And I'm vigorously rubbing the puppy because that's the best way to get stimulation both to the lungs, and to the heart to see if we can't get anything to start to move in the right direction. We are not breathing, but with puppies, you don't give up until you've been going for quite a while.
Half-tails, she's the one we actually need to catch.
At the Australian Reptile Park, alligator expert Billy and his team are still trying to catch injured female half-tail.
Come on. Yeah. Half-tail has proven really hard to catch, and Googly's making his way in, so I reckon we take the opportunity to catch him. Come on.
One wrong move with this big boy could prove fatal.
Try and walk him up as far as we can so we haven't got to drag him so far because he's so heavy. Googly is our biggest and most dominant male on the lagoon. He is an absolute monster. He is huge. He'd be over 400 kilo and almost 4 meters in length, and he's really dangerous, so we really need to watch him today. Yep, jump on. Yep, we got him. And Mitch, also, while we're doing this, you've got to keep an eye out for other gators. He's really, really dangerous. He's probably the most dangerous gator we have here at the reptile park. Blindfold. 3, 2, 1. Oh, his osteoderms are driving into his sternum. They're killing. His osteoderms, they're a floating bone plate under the surface of his skin, are jamming into my sternum. It hurts so bad. My arm's going dead underneath him because there's so much weight on it. You couldn't make a mistake here. You couldn't end up with any part of your body inside of those jaws. It'd just be game over. All right, paint, please. He's been fighting this breeding season. He's been punching on flat out with other males. He's got a couple of old bite marks on the side of his neck here that are healing up fine. But we just got to keep an eye on those sorts of things. I can feel him building.
Yeah, I can see it.
He's taking big breaths, ready to go. If he wants to, he flick me like that. Do you want to loosen this rope so I can have a bit here? Righto, Huey, you want to go? Yep, let's go. Great.
With the battle-scarred Googly heading back to the lagoon, Billy wants to see if injured Halftail has moved in any closer.
Halftail's right there. Can you see that? She's spooked again.
Hopefully that will give us a better idea as to what it is, but it does feel very soft. All right, let's go stain this.
In Sydney, Audrey is investigating a worrying lump on 10-year-old Zena's paw, hoping it's not a nasty tumour. Cells taken from the lump will give Audrey a good idea of exactly what she's dealing with.
Okay, so definitely we've seen some blood and a lot of white blood cells, so inflammatory cells, and a few sort of round cells that don't look like the nasty type, the typical nasty type. So we could be looking at something inflammatory rather than tumour, but this is only a snapshot of what we're seeing. It's probably best that we take the mass off, but that makes me feel a bit better. The X-ray will help me determine whether the bone underneath is affected or whether it's a bony tumour, and that's going to affect whether I remove the whole toe with the bone or I just try and remove this mass. We want to do the best thing for Zena and make sure it doesn't come back. Just going to stay like that. All right, X-rays. All right, let's have a closer look. So I've taken 2 views of the paw and having a look to see whether the bones in the toes are involved, and it's really good news. All the digits are clear, the bones look perfect, so it looks like it's just soft tissue. So good news in the sense that Zena gets to save her toe. I'm really happy with that. Let's go tell Mum the good news. So it's good news so far. So I've done the preliminary test that we talked about. So the x-ray, the blood test, and an aspirate of the lump. Now the good news is the bone is completely fine. So the third digit and the second digit, they look beautiful. The bone doesn't look like it has any tumors or anything in it. So my next step is going to be trying to remove this lump as a soft tissue and leave her toes intact, which is good news for her. It will mean that the recovery is a lot less traumatic and a little bit easier for her as well.
Cool. Thank you so much.
All right,
Love
I'll be in
you.
touch soon.
Thanks, Audrey.
Don't worry. Okay,
Bye.
bye. So now we know what to do in terms of what we're removing. I'm just figuring out, once I remove it, is there enough skin to close? Because whenever you're dealing with an extremity, like a hand or a foot, there's just not much skin there. And so if we remove a big chunk of it, you got to figure out how you're going to close it. So things like skin flaps, rotational flaps. I'm just going through that in my head and thinking about where I can grab some extra skin to close this down. It's going to be a bit tricky. Kind of see where it's burst through the skin. Look. Well, I just said the tricky part is just trying to remove the lump between the toes, because one of the toes is right in the way. So I've almost got to open it, separate it, and then just try and get between it. Nothing like a good challenge.
We are not bleeding. But with puppies, you don't give up until you've been going for quite a while.
At SASH in Western Sydney, emergency and critical care specialist Mara is desperately trying to revive Pippa's new puppy.
Unfortunately, I have no idea if we'll get this puppy back.
Pippa has had a complicated labour, and her first 2 puppies were stillborn.
Are you comfortable rubbing our friend like hell? Yeah. Great. Because I'm going to give our friends a little drop of adrenaline.
Keep rubbing or stop?
Nope, keep rubbing. Okay. I'm going to borrow your stethoscope while you're taking that. You can stop for 1 second.
Yeah, 1.2 liters.
Keep going. Really, with these ones, if after 30 minutes of very vigorous rubbing, oxygen, a little bit of adrenaline and atropine, you get nothing, only then do you finally give up. Yeah. But you just keep going and going and going because it takes them a while to realize that they should be alive. Well, it's hard. I know that this was not a planned pregnancy, but I know that Pippa is definitely a very beloved member of the family. And while there's always good and interesting things with emergency medicines, I don't have a great feeling about this. Yeah. Sometimes we don't win.
Yes, I couldn't hear one.
Yeah, no. I think we're done. Thank you, but we're done. And while it's sad, I can't sit and dwell on it for too long because there tends to be 3 or 4 other patients needing me to help them. Hi, baby. I'm sorry. I think you just took too long. Okay. You give them a couple of minutes of thought, might think about it some more on my drive home later on, but I oftentimes have to basically switch that concern off and move on to the next. Hello! We're gonna poke you, little lovin'. All right.
Now Mara is turning her attention back to Pippa, increasingly concerned she might still be carrying more puppies.
I'm just checking right now with ultrasound to see if there's any other babies that I can find. There is one, at least one more in there. I'm just trying to see if there is a heartbeat. Yes, there is a heartbeat. There's at least one more puppy in here with a heartbeat. Oh, beautiful. All right.
Half-tail, she's spooked again.
At the Australian Reptile Park, Billy's trying a new tactic to hopefully lure in wounded female half-tail.
I'm just trying to lure her with food. She's just turning again now. She's spooked and gone out the back again.
While Halftail continues to play hard to get, more of the other dominant males and females can be checked for injuries.
Get ready on the end of the ramp here. Go up a bit further. Yep. 1. Yeah, I'm good. Keep that pressure on. He's going to see which way he wants to go. Righto, pressure on. Just watch, we've got this other boy coming up. 3, 2, 1. She is massive. Be careful where you put your fingers now. 2, 1. And that's all of them.
With the most dominant, injury-prone males and females now tagged and given the all clear, the team can again try to round up the one they're most concerned about, Halftail.
Catching Halftail has proven to be really challenging. She's just sort of hanging at the bag, poking in. I've got gators all around me at the feed ramp, including Halftail, but she's just a little bit too far away. Hey. She's moving in towards me. I've got the rope there ready to go. All I've got to do is get it on her jaws. Almost had her then, like so close. Come on. She's right there. Come on. Yeah. I've got Halftail on the rope, right there, almost completely secure. Oh, that gator just... And then the male right next to her, knocked that rope straight off her jaw, and she's just speared back into the water. Now she's gone. I'm gonna have to try something new. Watch her.
Once I get mama and babies out of here, I'm happy then to lay hands on this one.
At Sash in Western Sydney, Mara and her emergency team are still flat out.
You just had a baby.
When suddenly, pregnant Pippa delivers her 4th pup.
Good girl. Good girl. Literally 2 minutes after the last check, she's just had a puppy. And so by the time we got there, she'd already licked the puppy clean. We missed the entire thing, but she did a good job on her own for that puppy.
There's a little girl. You got a little girl.
Oh, good mama. It's always great to get to see a live puppy come out, especially when we know that there's been dead ones that have come before. It just really gives us something positive to focus on when we've been dealing with sometimes some sad emergencies. It's a nice little gift.
Yes, we want baby screaming. What do you think? Are you gonna clean her up? Are you good mama? Yes, you are. She can hide under your ears. You know that? She could hide under your ears.
So Pippa's gonna go home, and she's probably gonna be a really good mom for her baby because how she's acted here in hospital so far, she's very, very involved. So I expect she's gonna spend the next couple of weeks at home, mothering that little baby, probably being really happy to no longer be pregnant.
You're a very good girl. Yes, you are.
Oh my God. Oh, you're too cute for words.
But she's under. There she is.
At the Australian Reptile Park, Billy still isn't having any luck trying to capture dominant female Halftail to check a nasty wound on her jaw.
And I just need a croc stick down here, Dylan.
Billy suspects Halftail copped a serious bite during an aggressive breeding season.
I actually got a really good look at the injury across her nose there, so she's actually lost a fair bit there. I need to have a closer look at it. All right, boys, we got her.
Finally, success.
Come running in. Grab these right. Turn it right. Just swing her.
What's the jaw? What's the lower jaw?
Lift it, lift it, lift it.
All right, top pull.
Go. This straight over here, line. Watch out, watch out.
Yeah, well, hold it.
Right, I'm going to blindfold. Just keep an eye for other gators. Just give her a sec. She's normally pretty wild, this one. Good with scanner, paint. Alrighty, let's do this. 3, 2, 1. Far out, that looks nasty. Have a look. Jeez. I can see here, like she's lost a fair whack of that top jaw. Really good bite, but looks like she's healing up pretty well. Alligators have got a fantastic immune system. They've literally got their own antibiotic in their blood system, which helps them combat these injuries.
I've got no slack on that.
All right, no worries. She can feel that straight away, and she's going.
Halftail has been lucky this time. If the wound was any larger, she would have lost her nose, a fatal injury for an alligator.
Far out, that took us all day to catch her. What a challenge. I'm stoked with how well today went. Halftail looks fantastic. She's healing up great. All the alligators look fit and healthy. Great result.
Nothing like a good challenge.
In Sydney, Audrey and vet nurse Emma are in the middle of a tricky surgery to remove a large and painful lump from rescue dog Zena's paw.
I'll pass it to you and you're going to pull in this direction. All right, it's coming away now. That's huge. Look at that. Oh, that's a lot. I'm actually surprised it's quite capsulated. I wonder if there is something in the middle of that, but we'll find out later. She'll be feeling a lot better with that out of her toe, for sure. So lumps come away quite clean, and this was the challenging part, just closing up the skin. But pleasantly, I'm quite surprised. It's coming together quite nicely, no flaps needed, so very happy. I was in two minds at the beginning of what we were going to do today, whether we remove the toe or whether we just tried to remove the mass. But I'm quite confident with how it came away and with all the diagnostic tests we've done, that hopefully it's not a nasty tumor and Zena gets to keep her toe. Oh, beautiful girl. Okay, yeah, there's your tongue.
3 hours later, Zena's owner Bonita can't wait to see her special girl.
All right, look who's here. We're still a bit groggy, Mama. Oh. Look at Tails wagging.
Oh, hello.
Show her your paw.
Oh, yes.
It looks much more normal, Mum.
Thank you. Thank you so much.
So surgery went really well. We just took away the fleshy mass and the bone was completely okay underneath, and that just came away as a really nice capsulated mass, so really easy to actually come away.
Oh, beautiful.
And there was enough skin to close, so it should heal beautifully. And I actually have saved the lump for you to have a look at before I send it off to the lab.
Oh. Wow. Oh, that's disgusting, but very interesting.
Yes, I mean, as gruesome as it looks, it's quite good for us to have a look at it because it's capsulated, it comes away as a whole. I don't feel like we've left anything else in there. And looking at the aspirate as well, it didn't look too nasty under the microscope. So hopefully it's a non-nasty one and we don't have to go back in and take anything else out.
Really good news.
Yeah.
Thank you.
But yes, we're still a bit groggy and we're still learning how to walk on that bandage. But once she gets home, she'll be a lot better.
Yeah. She'll feel comfortable at home.
Yeah. All right, so I'll let you take her home.
Thank you.
She's keen to go, the tail's wagging. And I'll see you in a couple of days. Thank you for being so brave.
It was much better than I expected. I was really expecting her to lose a toe, and so her to keep all her toes and be mobile, it's just really great news. And hopefully it's nothing too nasty as well. Thank you so much. I really appreciate it. All right, well, thank you. We'll see you.
Bye, Zena.
Come on, Zena. Out this way. Bye. Thank you.
Keep going.
In Sydney, Kate's on a rescue mission.
I'm going to see Axel, the 8-month-old boxer who is driving his parents absolutely mad.
Jess and Jerome live in a ground floor apartment with their 4 children and a very noisy and boisterous boxer called Axel.
Knock, knock.
Ah,
Hello.
Dr. Kate.
How are you?
Good, come on in.
Hi, beautiful boy.
Down.
Hello.
Good boy.
Come on. He's looking beautiful, you guys.
Oh, we love it.
Do you love cuddles? You do love cuddles. I have known Axel his whole 8-month life, and he is absolutely beautiful. But he is driving Jess and Jerome absolutely up the wall. So you guys have called me for a very specific reason.
Yes, barking. Barking when we don't pay him any attention.
Okay.
As soon as we talk to each other or we watch TV and we don't pay him the attention, then barking. Down, Axel. He's our first dog that's ever graduated from puppy school, so we were really proud of that. But after that, it's like, how do you train your dog to make sure that they don't do things that are annoying, like barking? We live in an apartment block, so we have to be mindful of everyone else, and we hate for him to bark.
Yes. That's something that is going to cause these neighbours to complain.
Down, Axel.
May even result in them having to rehome or actually get rid of Axel. And what happens when you ignore him? Because I presume that you've tried that.
It just gets worse.
Okay.
We end up either taking him out for a walk or giving in to him and giving him something.
All 4 of my children know he's my favourite child. We just love him, but we have to do something. We just need to stop it.
He is like a 2-year-old child.
Exactly.
He is like, everyone pay attention to me at all times. It's out of control. They can't continue as they are. We have to figure out a solution for them.
Down, Axel. Down, baby.
I'm going to get you guys on the couch. I'm going to get you pretend to watch TV like you would at night. And I'm going to sneak around the corner and see what he actually does.
Okay.
Kate wants to see for herself Axel's behaviour when he's not the centre of attention.
Axel, down. Axel, Axel, down, baby. No. Axel, no.
This is out of control. They live in an apartment building. They can't have this continue on.
Why are you barking?
It's not a good boy. Not a good boy. You get all the attention. Our biggest fear that we have to get rid of him, and that's just not an option. It's like saying get rid of one of your kids. Axel.
It doesn't take Kate long to work out why Axel is so needy.
He's relying on you guys to entertain him, and he doesn't like that you two are interacting and ignoring him. And exactly what he's saying is, I'm bored.
Yeah.
He's saying, bored, bored, bored. I'm bored. I want you guys to entertain me. Boxers are absolutely lovely dogs. They're one of my favourite breeds, but these guys are absolutely high energy.
We can throw a ball forever, come home, we're tired, we'd want to sit down, have dinner or watch some TV, and it's just, what's next?
But we can't have that go on for 2 or 3 years. And it's not going to get better unless we address it. This is not something that Axel is going to outgrow. And that's one of the common misconceptions about this, is that they think, you know what, he's just a puppy. The reality is if we don't fix this now and we don't get on top of this now, he's going to end up at 2 or 3 with exactly the same problem, if not worse. If this goes on, you guys are going to get kicked out of the apartment building.
Oh, for sure.
Yeah. Boxers are high energy. They need lots of walking, lots of activity, but they also need a lot of mental stimulation. We're going to teach him how to play by himself without relying on you guys. So there's heaps of puzzle games for dogs. We've got a little activity ball, right, which we load with treats, and then he has to actually figure out how to actually get the treats out. There you go, try that. He's going to spend hours playing with this rather than annoying you guys.
Oh, you got it.
These little brain activities and these little puzzles are twofold. So not only are they keeping him entertained, so these guys can sit on the couch and not have him in their faces, but it's also meaning that he's getting tired by using his brain.
What's in there? Oh.
What I want you to do is put all of his regular food in one of these instead of him getting dinner.
He is so focused on that toy, his paws are working. You can actually like almost smell his brain working.
So the final part of this is rewarding calm behaviour. Oh, oh. Perfect. It's exactly where he's supposed to be. This is the perfect behaviour. This is what we're trying to get him to do. We want him to get to a point that he can relax on his own. It looks like it's a treat for nothing, but it's not. It's reinforcing just that he needs to be calm. Allowing him to teach himself how to self-soothe.
Amazing.
Perfect box of behaviour. This is the way that people should engage with their dogs all the time.
He's not barking.
He's not barking.
So beautiful.
Well.
Yeah, you can do it.
You're a good boy. Yes, you are.
A week after Audrey removed a worrying lump from elderly rescue dog Zena's toe, the lab results have come back all clear. And Zena's toe is healing well.
Come down. Look what I've got for you. Isn't that fun?
And a month after Kate's visit, Axel's incessant barking has almost stopped.
Yum.
Food puzzles are helping to relieve the energetic young boxer's boredom, and owner Jess couldn't be happier.
We are challenging him every day, and we are watching TV in peace and quiet every night.
Good girl.
Excuse me, Rob, I've just had an emergency come through.
What's happened?
This is 9-week-old Chico, and it's American Staffy. She has been elsewhere extremely lethargic.
She's pale.
Hot to touch. They didn't perform any x-rays, nothing's been done.
Let's go.
Okay, let's go.
In Sydney, little Chico has been rushed in to Rob. The 9-week-old pup is extremely unwell.
It certainly feels hot all right. Pulse is not strong. And the abdomen, this upper quadrant, feels really weird. Bouncing off something in there. Okay, 39.6, it's up a bit. It feels hotter than that. It feels really hot. And look at this lymph node, there. The lymph system fights infection. The nodes are right through your body, scattered through to help fight any infection. If they're all up in an older dog, severely up, you worry about cancer. In a young puppy like this, first thing I'm thinking of is infection of some kind. You look a little bit sad, baby boy. This guy's just pretty flat. It's got a bit of a temperature. It's inflamed lymph nodes, very pale gums. So we want to find out what's going on. Is it an infection, or is it something inside him that's wrong, like a foreign body? Let's ultrasound pup straight away. This thing is just flat, staying there, perfectly still. Doesn't want to move too much. Obviously in a lot of pain. What's that? What is that? That foreign material inside there or not? There's his liver. What is that? That is... This keeps coming up consistently in that spot. Because they said he hasn't eaten for a few days, so... What is going on with this dog? Let's get some x-rays and see if that adds more to the story, eh? Okay. Hold on there for me. He hasn't eaten, so what's in the stomach? It's full of something. And there's lots of gas in the large bowel. What's going on with you, baby?
All right, let's go.
Audrey is at Sydney Zoo and way out of her comfort zone. Instead of domestic cats, Audrey's going to be tackling two of their more powerful, dangerous predatory cousins, cheetahs.
They don't look so big from this far away. Although I do see cats every day, this is a little bit different because they're big cats. They've got sharp teeth, they've got sharp claws, they're sheer size, and I'm a little bit nervous to be so close to them.
Audrey's patients will be 6-year-old males Obi and Akiki, who are getting their head-to-tail annual health checks.
Wow. You can see the cheetahs walking around and moving around, and you can just see they're built to be predators. They're muscly, they're fast, their teeth are really, really strong. It's not the typical cat I'm used to.
Audrey will be working alongside zoo vet Creason.
We've got 2 cheetah in there, so Obi's a little bit more anxious, so we want to get him done first, make sure it's nice and smooth.
Creason will need a steady hand and calm nerves for the first dangerous task, safely darting nervous cheetah Obi.
So first you choose your darts, and we just need to make sure that they're working properly. So you always test them. You never want to dart the animal and then realize, oh, my dart's not going to be working. I'll just sneak in here and dart it. Yeah? Okay, dart's in.
It will be a tense few moments as the team waits for the dart to take effect.
if this animal gets too light, he could potentially bite us. And if he gets too deep, we could potentially lose him. So there's a bit of stress here because I haven't done a cheetah before. He's twitching.
Audrey, I'm just checking. So just using the broom just to check. And he's not reacting. I'll go in now. Good?
Yep. Now everyone is on high alert. If Obi shows the slightest sign of waking up, the team is in extreme danger.
Audrey, you gonna come in?
Yep. Now I'm starting to get nervous. This big cat is gonna come out into the van with us at the back. It's getting very real now.
This is the part Audrey is most anxious about, sharing a confined space with a deadly big cat.
My heart is thumping. I'm in a small space with a very, very big cat. This thing could kill me in a second. Just don't wake up.
What is going on with this dog? In the stomach, it's full of something.
In Sydney, Rob is still struggling to pinpoint exactly what's wrong with extremely unwell pup Chico.
Turn them around.
Rob's hoping an X-ray will provide some fast answers about the little dog's worrying symptoms.
It's confusing because they say he hasn't eaten for a few days, but looks like there's something in that stomach. A lot of gas in the large bowel right through. Certainly something's going on. Let's get some blood from him, run that fast, and then decide about surgery. I'm still baffled with the X-rays. There's a lot of gas and fluid in the large bowel, and there seems to be all this stuff in the stomach and in small intestines. And again, this dog has not eaten, but it hasn't passed anything either. So is there something blocking it? I am not sure. You've been a good boy. No puppy normally would stay this quiet while it's having blood taken. Certainly not an American Staffordshire. Poor old Chico, he's very quiet. So we're going to rush the blood through, see if it shows anything terrible, and pending that final result, we'll go to surgery.
Emergency surgery will be a last resort if the blood test results fail to provide any vital clues about Chico's mysterious illness.
Doesn't make sense. White cells are normal with those big lymph nodes. Red cells, well, yeah, okay, expected a bit of it. We've got a lot of anemia there. Kidney count's up a little bit. Everything's up a little bit, like calcium, phosphate and glucose. All the other enzymes are normal, but it's not giving me a revelation of where the problem is. I think it's time to open him up. I don't want to lose him.
Good girl. So we're going to go inside. It's going to be okay.
In Melbourne, anxious owner Tara is making an all-important return visit to see newest Bondi Vet member Matt with her beloved greyhound Daisy.
So about a month ago we noticed that Daisy had a bit of a growth on her mouth. We wanted to get the biopsy done. We were told that it could be cancerous, so we had to sort of prepare ourselves for that possibility. Yeah, you're such a good girl. Hey.
Tara's desperately clinging to the hope that test results will show the lump that Matt discovered in Daisy's mouth isn't cancerous.
Hey, that's a good girl.
Daisy and Tara, hi, how are you going?
Good, good.
Hey, sweetheart. It's all right. Just nervous, aren't you?
Yeah, nervous Nelly. So because of Daisy's sweet nature, she's also very shy.
We're going to help you out today, don't worry. This way, sweetheart. Good girl.
Come on. In you go. Good girl.
Daisy had a small lump around one of her teeth on her lower jaw. When I looked at it, it was obviously some kind of a mass that, shouldn't be there. The majority of the masses you can get in the mouth are not friendly. So how's things been since our last visit?
It's looking a little bit more angry, a little bit larger. So
yeah, I can see from here it already looks a little bit bigger. And we've got a little bit of bleeding there too. Has that been happening at home?
yeah, there's a bit of blood happening that night, especially.
Yeah, definitely it's grown quite a lot since last time. I can feel it swelling down here below the jaw. So it definitely is growing and starting to spread.
3 days ago, Matt took a sample of the worrying growth and sent it off for urgent analysis.
The results have come back. The pathologists think it's a squamous cell carcinoma. This is a kind of cancer that we sometimes do get in the mouth. No cancer's a good cancer, but this is one that we do need to intervene in. It can start invading tissues around the mouth.
Daisy is going to need major surgery.
We maybe have to try and remove that part of the jaw that contains the tumour. Good girl. The rate this cancer seems to be growing, if Daisy didn't have surgery very soon, the cancer's going to invade a large portion of her mouth, and as it grows, it will grow exponentially, and before you know it, it's going to be painful for her, and eventually it's going to affect her ability to consume food and survive, and she's going to start wasting away.
You're going to be all right, sweetheart.
Poor little girl. We're going to help you out today.
Be good for me, Obi. We're going to be there soon.
At Sydney Zoo, it's a short, bumpy and extremely tense ride for Audrey and fellow vet Creason.
Nice and calm and relaxed is important.
They're anxiously monitoring a 50-kilo anaesthetised cheetah en route to the zoo hospital for the young male's annual health check.
You can go straight, it's fine.
It's the first time Audrey has been this close to a killer big cat.
That's a van ride I'll never forget. I know what it's like to be bitten by a cat. In fact, my cat's given me a few swipes and a few bites, but I cannot imagine what it would be like to be bitten by one of these things.
Obi will be kept under anaesthetic for as short a time as possible.
Gosh, it is huge.
So the head-to-toe checklist must go like clockwork.
It's a big, big list to get through. I've got one chance only to do this.
Okay, go.
It's all go, go, go. There's no time to be nervous or scared now.
It's exciting. We have a cheetah on the table. We have to move quickly now, don't we?
It's a very heavy head here.
Audrey, I'm just putting him on 1%.
Okay.
Isoflurane as well.
Stakes are definitely a bit higher than a domestic cat. He's got some big teeth there. We start off with his claws. They're huge.
So almost like studs on his shoes.
Yeah.
That's why they're so fast.
The nails don't retract like a normal cat. They semi-retract.
And they've got pretty hard foot pads. It's not as soft
it is
as
much
other cats.
harder than a cat.
It's literally like a tire.
So they tend to go a little bit blue in the tongue.
He is going a bit, yeah.
Do you want any breath?
We can give him a grape.
Oh gosh, was that a blink, guys? So the blink reflex is kind of throwing me off a little bit. They still have that blink. That freaks me out.
So these are those massive carnassial teeth that we talk about in carnivores.
Yep.
So we're making sure it's nice and clean and there's no signs of infection. He's got really good teeth.
Just wow. Next step is x-rays.
No, skull.
Skull?
Okay. Skull.
And x-rays in a big cat is not easy. We've got to make this milk crate tower with a bar across the top so we can hang the x-ray machine and get it into the perfect position. And we've got to get a couple of views because we've got to take this whole cat. X-rays. Very happy with those. The x-rays look great.
Cheetahs are prone to life-threatening kidney and liver conditions, so ultrasound scans are a vital part of today's checkup.
That's fine, that looks good.
Very good. And then
Let's
you'll take
see
some
if
urine.
Get some urine. Okay, got that.
Good bill of health.
Obi's health check has gone smoothly, but now they need to safely transport the dangerous big cat back to his enclosure before repeating the process with the second cheetah. No one can relax.
Here we go again.
Audrey, can you sit up?
Yep.
Keep an eye on him. He's on gas again.
So far, so good, Obi.
Yeah, definitely it's grown quite a lot. And that is a little bit concerning.
At the Port Phillip Animal Hospital in Melbourne, Matt is shocked by the rapid growth of greyhound Daisy's mouth cancer.
It does look like it has gotten quite a lot bigger. It's a lot more vascular, so we're getting some bleeding there, which is concerning because a cancer with a good blood supply is fast-growing cancer.
Daisy needs urgent surgery, which will involve removal of a large section of her jaw, and recovery will be challenging as she adjusts to a dramatically altered mouth.
It seems like it's grown quite quickly, and it seems like she's quite sensitive and painful around it already. So I think that, you know, we may have to take out quite a bit of that jaw to make sure that we get it all. Going to have to be, you know, reasonably aggressive. Most of these lumps will require removal as soon as possible to stop them spreading.
It's not the news owner Tara was hoping for.
A bit shocked, a bit overwhelmed to be honest, but I know that she's in really safe hands with Dr. Matt, and we've been really happy with the care we've received here, so I'm just got to be hopeful for her. Well done.
Fortunately for Daisy, this isn't one that's end of the road, but this is one that we do need to intervene in. I just think if we're not aggressive now, we might lose our opportunity to get on control of this while it's still...
Definitely want to nip it in the bud.
Yeah, exactly. Yeah. If we delay it too long, we're going to end up having to take the entire half of that jaw off, which is obviously much more traumatic for Daisy and less chance of getting all of the cancers.
We'll see you really soon, okay? We're going to take good care of you, okay? I love you, my darling. Bye, darling. You'll be fine.
Come on, Daisy. Come with me, sweetheart. Come on. Good girl. We're going to give her plenty of pain relief and plenty of cuddles and just make sure that she's best taken care of as we can. Ready to go now, nice Daisy? You look very relaxed.
I know, she does, doesn't she?
With Daisy fully anaesthetised, Matt can get a better look at the extent of the nasty tumour.
It's actually looking a lot bigger than I initially thought it would. It seems to be stretching right down into that bone. So this is a very timely procedure to be getting in here. It was a little bit of a surprise. The comment from the pathologist said that the cells didn't look extremely aggressive, but certainly the gross appearance of this cancer just seems to suggest otherwise, and that it is growing quite quickly. So we're going to probably look at cutting probably here and back here. So it may even be more like sort of 3 inches or more. It's a very nasty looking thing. We'll go and we'll take a couple of quick x-rays of that jaw. We're going to have to take reasonably big margins on this, which means a lot of tissue, a lot of bone, some teeth to ensure that we get all that cancer out. X-ray. This is about where the cancer is. So we're going to try and remove back to here and up to here. We're going to try and remove this portion of the jaw to make us feel a little bit better. It's never fun to do these aggressive cancer surgeries on dogs, but the downside is if we don't do it, she's really going to suffer and her life's going to be very much shortened.
Doesn't make sense. It's not giving me a revelation of where the problem is.
In Sydney, Chico's blood test results have come back inconclusive.
I think it's time to open him up.
Rob must now perform emergency surgery, fearing whatever is wrong with the 9-month-old pup's intestine could prove fatal.
Hasn't gone to the toilet for a couple of days, hasn't eaten for a couple of days, nothing's going on that's correct about him. The problem is if I wait and he has an obstruction, he could die overnight. Now, I'm not into that. I think only real option is let's find out, let's open him up and just see what's going on inside. We may find something, we may not. That's the truth. But leaving him like this, too dangerous. The unusual thing with the bloods were, this dog's got big lymph nodes, sign of infection. So it could be a severe infection that's got hold of him very fast and his body hasn't even been able to react in 48 hours. If I'm wrong and he doesn't need a full surgery, I can just sew him up, he'll be okay. But if it is mechanical and I leave it, he could die overnight. Tell you what, looks angry. Yeah, there's something in here, in this large bowel. Lap sponges, please. There's definitely something there. Fiona's telling the truth, and this puppy hasn't eaten to the best of her knowledge. He certainly swallowed something. It's in pieces. Ooh, yow! Look at that.
Wow.
We're going to try and remove this portion of the jaw to make us feel a little bit better.
In Melbourne, Matt is about to perform radical surgery to remove a rapidly growing cancer from rescue dog Daisy's jaw.
It is going to be very challenging because if I don't get those margins, then we're almost back at square one, and the chances are worse that the cancer may have spread.
The shy 9-year-old greyhound has won Matt's heart.
She's a lovely dog, and she's come up through the greyhound adoption program and found a nice family, and it'd be horrible if she didn't get to live out her full life now that she's on Easy Street.
It's going to be an anxious wait for devoted owner Tara.
I feel a bit nervous leaving Daisy here today because it is such a major procedure that she's going through, but I also feel confident that she's under really good care.
So what I need, Michelle, if you can try and hold this lip as far away from the jaw as possible so I can make an accurate incision.
As Matt begins the delicate surgery, he's feeling the pressure.
We've got a big blood supply, which means big blood vessels, arteries and veins that we're going to have to deal with. There's also, as you can imagine, a lot of nerves in the mouth that tell the brain how we're eating, what we're tasting, all these sorts of things. And we're going to be obviously cutting through those.
Pretty brutal, isn't it?
Yes, pretty brutal. We're going to have to get rid of all the soft tissue, and then once we've done that, then we can drill through the bone and remove the whole chunk of cancer and the surrounding tissues, hopefully with good margins. Can you pass me that drill? So that's the artery that's going to be the problem. All right, so this is what we've been after, that. So we've got about 1 centimetre or so behind it, and we've got more like a couple of centimetres in front of it. So hopefully that's enough. Nasty looking thing. I'm a little bit surprised looking at the jaw, just how deep into the bone the cancer's gone. I may just take a little bit more bone, just because the caudal edge of that sample just looked like it was a little bit close to the tumour, and I just want to make sure I can sleep tonight, that I know that I've got enough. Even if we leave a few cancer cells, they're going to multiply, and sooner or later we're back in the same position with another big cancer there, which I don't think Daisy wants, and we certainly don't want either. So that's that part done. I'm a bit more confident now that I took that extra little piece. That'll just help me to sleep a little bit easier at night. You doubt until you get the pathology report back, and then sometimes you still doubt a little bit more. So the jaw finishes here now. That's the end of the jaw. And back here, the jaw starts again. So we've lost that portion.
As a precaution, in case the cancer has spread via the lymphatic system, Matt's also removing the lymph node at the back of the jaw.
Michelle, have you got that pot? So this lymph node is very small. It doesn't look like a lymph node that's being taken over by cancer cells. Then I really got my fingers crossed that the lab doesn't find anything in there. So you've done pretty well there, Daisy.
Before Daisy is moved to recovery, Matt's taking another X-ray.
X-ray.
All good?
Yeah, I think that's good. Okay, so this is the after X-ray. This shows us the area of bone we've taken. So we've removed the cancer and then a couple of centimetres in front and behind. That's it, wake up time, rise and shine. Look, I'm pretty happy with the surgery on the whole. We closed everything up, it looks reasonably tidy. I do know that within a few days, Daisy's going to be in a lot less pain than she was today, so I feel good about that, but I'm still going to be nervous waiting for that email to come through from the pathology. That's a good girl, you stay nice and warm. Got that horrible cancer out, here's hoping you feel very much better soon.
We're nearly there, Obi. Just stay asleep for a tiny bit longer.
At Sydney Zoo, Audrey and Vet Creason are once again making a short but nerve-wracking journey in the back of a moving van with big cat Obi.
We opened up the first meal, it's fine, and the second one's quite stressed out.
The young cheetah has just undergone a full health check.
We're near the bitey end.
And the team wants to reverse the anaesthetic as quickly as possible.
Got reversal on you?
Yep, got it.
Syringe, yeah.
Go.
It's time to make sure Obi wakes up safely.
Yeah. And we're just letting him get rid of all that anesthetic gas because he's blowing it out.
Obi's brother is keeping a close eye on the action, unaware he's next.
Yeah, so we just note that time, Audrey.
Yeah, 9:16.
You can pull up your stretcher. You can see his breathing has increased, it's getting nice and deeper.
so he is getting a bit lighter.
Good morning.
So we'll keep an eye on him. I'll just go get the other dart ready and load.
With the vet team safely out of the enclosure, Obi is beginning to stir. They can now shift their focus to Akiki.
Akiki's watching Obi.
Okay, all good.
The team must work quickly to make sure Akiki doesn't become distressed by all the commotion.
You can see what's going on.
If his adrenaline spikes, there's a chance the anesthetic dart may not work.
He was more fixated on Obi, so it works in our favor. He was worried about his brother, but he's probably going to go down soon.
Fingers crossed Akiki behaves just as good as his brother. As a team, we've got to work super fast because every minute under general anesthetic is a risk. Okay, Akiki, so far so good. Good boy.
Let's go, we need to be quick. Cheetahs are prone to a few diseases. This is why we're doing these checks, to make sure that they don't have early starts of that.
The team must complete a thorough checklist, from the big cat's terrifying teeth to his impressive tail.
They always save this job for the newbie.
Creason has lined up a special finale for Audrey's first cheetah experience.
Now it's time for the all-important test, the fecal test. So here we go, got to get my glove on, get a good fecal sample for Creason. We've almost finished. I can see the light at the end of the tunnel, but you can't let your guard down. Okay, one more van trip to go.
It's been a tense few hours, and Audrey is relieved this is the final trip inside a small van with a potentially lethal big cat.
I've got the reversal.
Very happy with how everything went today. We got all the samples we wanted. We've given our cheetahs a clean bill of health. Okay, just remember the time we're giving.
10:38.
Audrey performed amazingly. She was really calm and relaxed, and everything went perfectly well.
Oh, so that was pretty intense.
Yeah.
Two and a bit hours, and we've done both of them. Good bill of health. Good job.
Yeah. Thank you. Every day's a new exciting adventure for us here at Sydney Zoo.
This whole experience has been amazing. Just to be up close and personal with cheetahs, have a look at their teeth, and look at how everyone as a team works together to make sure everything goes smoothly. Good boy, you're waking up nicely. As much as I've enjoyed myself today, I still wouldn't want one of those big cats in my van. Do you think you heard that? I hope not.
Certainly swallowed something. It's in pieces. Ooh, yow! Look at that.
Wow.
In Sydney, Rob has finally located the mysterious object that seems to be blocking Chico's intestine, making the little dog critically unwell.
So whatever this is, we hope we can get it all out in one piece. It feels very long. Oh, still coming. Ooh, look at that. Just ripped a bit of towel off something. Eaten the whole thing. Swallowed it whole. Typical American staffy, they want to play, they grab something, they rip it and they want to swallow it. Yep, he's done that. Somehow he's got a piece of material from somewhere and swallowed it. It could have balled up into one ball and blocked everything. It didn't do that. It had been completely blocked. Everything would have been over in 24 to 48 hours. Okay, let's sew this intestine up and get out of here.
Rob is hugely relieved he's been able to save little Chico's life.
Before surgery, this puppy was, I think he was going to die. You know, very quiet, pale gums, bloods weren't good, nothing was good. I think now he's got a damn good chance of surviving, and I'm very happy with it. Okay.
Been a bit of a rough day, hasn't it, sweetheart?
In Melbourne, rescue greyhound Daisy is now fully awake after Matt performed major jaw surgery to remove a nasty cancerous lump.
You all set to go, sweetheart? You go see your mummy?
Devoted owner Tara has spent an anxious day, worried about her special girl.
I can't lie, my day has been a little nerve-wracking, just waiting for the call from Dr. Matt.
Here she is.
Daisy, hi. Hello, gorgeous. How are you feeling?
Been so brave.
So good. She's such a trooper. Look, it looks a bit confronting, but I know that after the stitches come out and everything, she's going to be having such a better quality of life. So I feel really grateful.
So she's gone really well. Obviously she's missing a part of her jaw just here.
Yeah.
So it may get a little bit swollen. No, don't panic too much.
As Daisy recovers, she'll also have to get used to chewing differently.
Look, the dogs are very, very good at moving food around their mouths and chewing on one side if one side's painful or has some dental disease. There'll be a short period of adjustment, but I think that she'll cope really well. Soft food, as soft as possible, so she doesn't have to do any chewing.
I think Daisy is very keen to get home and get on the couch, get snuggled up and have a bit of chicken.
So we'll be getting the lymph nodes back in a few days. I'm fairly confident. It looked very small and unreactive, so I'm hoping that that's going to come back pretty clear. The bone will take a little bit longer. They have to decalcify it, so we're probably looking at a week or more until we can get results back from that one. I think we're all going to sleep a little bit easier knowing that that cancer's not in there growing anymore.
Thank you so much.
No, that's no problem. Hopefully she's jumping forward in leaps and bounds and there's no holding her back now.
Let's get going. Good job, honey. Let's go. Good girl.
Jimmy, we need to have a little bit of a talk about your scratching situation.
In Bondi,
Hey, don't eat the rug.
Kate's new housemate is causing havoc.
Oh my goodness.
3 weeks ago, Kate discovered Jimmy living in a cattery in her hometown of Canberra.
It was like love at first sight. I knew what kind of cat he was when I got him. I felt like as though the moment I patted him, I thought, this cat's mine. Jimbo, that's what we'll call him. We're going back to Sydney.
Back in Bondi, it wasn't long before Jimmy began to show his true colours.
Don't. He just went at my face. Oh! And split my lip open. And that was the first, I guess, hurdle in our relationship. Now, Jimmy, be nice to Benny.
Kate's 14-year-old golden retriever Benny is also under siege.
You don't own this couch. Benny you need to share. You two, sharing.
Jimmy's also wrecking Kate's furniture.
Hey, don't eat the rug. Hey, don't eat the rug. Jimmy is a total destroyer. So I went out and I literally bought him like 4 scratching posts. He's got them everywhere. I tried to encourage him to use these scratching posts and he never uses them, ever. We just can't live like this with you destroying everything inside. And people, no. Dogs, couch. This is just not gonna work. Like I don't know actually how to stop this. Come on, mate, this way.
Finally, Kate's come up with a plan to end Jimmy's reign of terror, and it involves a visit to the vet hospital.
Hi, I've got everybody. Jimmy and Benny.
Oh, Jimmy, what are you doing?
So I've got this problem with his scratching, but I do have a solution. I don't know how this is gonna go. You know that he gets really stressed. Oh, hey buddy. Oh, Jimmy. Jimmy little. What I'm actually gonna do is put some nail clips on him. It's a bit like having your nails done. He's gonna hate it, but it is gonna be amazing. It doesn't hurt him, it doesn't affect him. It's going to mean that Jimmy can't destroy my furniture, or me, or anybody else for that matter. We're just gonna give Jimmy an anti-anxiety. It's not a sedative, it is just an anti-anxiety. I know Jimmy, he gets really stressed, and I don't wanna put him through that. There you go. Okay, see ya. Back in your bag. See you later, kid. But what I've learned about Jimmy is that his anger comes from a place of stress. So when I know that, I feel for him. All he wants is for someone to love him and love him unconditionally, and that's me.
An hour later, it's time for Jimmy's makeover.
Whoa. He's
Do you
a
feel
bit
better?
wobbly.
The first step is to trim Jimmy's razor-sharp claws.
He's really relaxed, he's calm, he's definitely not carrying on like a pork chop. Like this, get his claws clipped. I have wanted to do these nail clips for ages. I've seen them on the internet before and I've never had a chance to actually use them before. Jimmy was the perfect candidate. I feel like this black colour is great for him.
Yeah.
So this is a first for all of us. So look at them, they're nice and soft and there is going to be no furniture scratching.
Oh, look how cute.
Despite the anti-anxiety medication, Jimmy's patience with his pedicure is wearing thin.
He doesn't like me playing with his paws. He's giving me some warning signs saying, you continue and you will get nailed. Don't bite. On borrowed time.
Okay.
We need to be quite quick at getting this last one on because Jimmy is having enough. Jimmy is getting way sick of being here. He's like, I've had enough of this. He was pretty tolerant at the beginning, but towards the end he is starting to lash out and I can start to see his anxiety come through.
Good boy. Good boy. It's okay.
And on. Look at you with your little black nails. Look at these little, look at these.
Oh, you're handsome.
Don't like it, do you? Are you okay there?
Ooh, yow. Ugh.
6 weeks after Rob performed life-changing surgery on pup Chico, removing a dangerously long piece of cloth from the pup's intestine,
Ooh, look at that.
the young dog has made a full recovery. And his diet now? Definitely food only. No more pieces of dangerous cloth are on the menu.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way. That way.